check, hey, check, 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 hey, check, check, hey, check, hey, check, 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 hey, check, check, hey, check, 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 hey, check, hey, check, 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 check.
check, check, one. Hey, check, check, check. Hello. Hey,
Good morning, all of you, and good morning, one and all. We are here for the start of the surgical quiz, and I hand over the mic to Dr. Divi Saxena for further proceedings. So be seated, enjoy the quiz.
So good morning, all. So we are starting with draw of lots. Welcome to 29th late Dr. Indrajit Mitra Memorial Undergraduate Surgical Maharashtra Level Surgical Quiz. So as we announce the name of the college, one person from your college should come here, will pick up the chit and pick up his college placard, and then again sit in the audience. So we will do draw of lots by this manner, right? So we will be starting with Dr. Ulhas Patil Medical College, Jalgaon. Any one of the team member can come down. Ulhas Patil Medical College. Yeah, having breakfast. So next team is GMC Akola. GMC Akola. PDMC Amravati. Soumya. Soumya. Ask them to come down. Anyone represented. Ulhas Patil Medical College. Students from Ulhas Patil Medical College. Yeah, please come. Anyone from your team. GMC Akola. PDMC Amravati. Yeah, pick up a chit. So this chit will decide which qualifying round you will play and at what team. So you will be playing qualifying round 3 team A. Please somebody write. Okay. Qualifying round 3 team A will be Ulhas Patil Medical College. So you will be playing round 3 as team A. GMC Akola. GMC Akola, yeah, please. So you will be playing qualifying round 1 as team C. 1C. PDMC Amravati. PDMC Amravati. Yeah, please come. Next is MGIMS Sevagram. PDMC Amravati. Yeah, please come fast. Just pick up a chit. So PDMC Amravati will be playing qualifying round 1 as team B. 1B, sir. PDMC Amravati. MGIMS Sevagram. So MGIMS will be playing qualifying round 2 team E. E. Next is Vasantarav Naik Government Medical College Yavatmal. VNGMC Yavatmal. So you will be playing qualifying round 1 as Team A. GMC Nagpur. Next is GMC Chandrapur. Please stand here. GMC Nagpur will be playing as qualifying round 2 Team A. So 2A. GMC Chandrapur. Next will be AIMS Nagpur. So GMC Chandrapur will be playing qualifying round 3 Team E. AIMS Nagpur. So you will be playing qualifying round 1 as Team F. Datta Meke Medical College Nagpur. Next is BJGMC Pune. So DMMC Nagpur will be playing qualifying round 3 Team B. 3B, sir. BJMC Pune, NKP Salve. Next is NKP Salve. So BJMC Pune will be playing qualifying round 3 as Team D. NKP Salve. Next is Seth GS Medical College, Mumbai. So NKP will be playing qualifying round 2 Team F. Seth GS Medical College, GMC Nanded. So Seth GS will be playing qualifying round 1 Team D. D. 1D. GMC Nanded, GMC Vidisha. GMC Vidisha. Nanded will be playing qualifying round 3 as Team F. GMC Vidisha. Yes. GMC Gondia. GMC Gondia. Students from GMC Gondia. Vidisha will be playing qualifying round 3 as Team C. GMC Gondia. Harshit Gajbihar, Rajnandani Singh, Komal, Bafna. Next is IGMC Nagpur. So you will be playing, IGMC will be playing qualifying round 1 as Team E. JNMC Savangi. GMC Gondia. Qualifying round 2 Team D. JNMC Savangi. So JMC Gondia. नंबर कोई नहीं है. Okay, sir. Qualifying one. Yeah. So the teams who are playing qualifying round 1. Sambhaji. GMC Sambhaji Nagar. Anyone. Sambhaji Nagar will be playing qualifying round 2 Team C. And GMC Gondia, you don't have any option for last hit. So you will be playing qualifying round 2 as Team B. Okay. So qualifying round 1 teams are GMC Akola, PDMC Amravati, VNGMC, AIMS Nagpur, Seth GS Medical College and IGMC Nagpur. So I will call you by name. Before that, we will just look for the general rules and the rounds. So please be attentive. Hello. Can we have the display? So on behalf of Association of Surgeons Nagpur, I welcome you all for this 29th year of late Dr. Indrajit Mitra Memorial Surgical Undergraduate Maharashtra level quiz. So we are extremely thankful to all the participants, dean, heads of the department, teachers, their mentors, chief guests, guest of honor, all members of ASN, past presidents, invitees, and above all the students for attending this quiz. General rules, specific rules for every round will be told at the beginning of that particular round. For, for all rounds, if the team asks for repetition of the question, it will be done, but the clock will remain on and team will lose time. Each team is advised to identify a spokesperson to avoid double answer. If you don't want to attempt a question, please say pass loudly. Quiz masters and judges' decision will be final and binding on all the teams. All the participants are requested to please do not carry any electronic devices, your mobiles, tabs, iPads. Please keep it on the silent mode and keep it in your bags. Do not bring it on the stage. Rules for the audience. Now, audience is requested not to shout the answers directed at the teams. During each round, audience will get enough questions to answer. Those from audience who want to answer will raise their hand and wait for the audience manager to randomly select it. The selected person will state his or her name. 3 attempts from the audience will be entertained. Unanswered question will go to the participants where individual will be awarded for correct answer. Spot prize will be given for direct answer, right? So please do not scream, do not discuss when the question is directed to the team, right? So here is the quiz map. So see carefully. We are having 3 qualifying rounds. You have already selected your qualifying rounds and the team number on which you are playing. So we will be having 4 rounds in the qualifying rounds, starting with true or false, spot the diagnosis, ward chale hum, and before knives are out. So after these 4 rounds, for each qualifying round, there will be selection of top 7 teams in order of scores amongst all the teams. It will not be like that from qualifying 1, 2 team will be selected, from qualifying 2 teams will be selected. It will be general total. Uh, the top 7 teams will go to the final. So in final, this is the quiz map. So first round will be hunt the hints, that is based on allusion. Second round will be connecting the dots. Third round will be emergency mystery round. Fourth round will be surgery on reels, which will be a audio visual round. Fifth round is a super specialty round. It's a buzzer round. Sixth round is based on cryptic clues. And then last will be the rapid fire round. So there are 7 rounds to be played in the finals to win the trophy. Now, the most important part is the introduction of our quiz master. Please have a round of applause for our quiz masters who have worked hard tirelessly for the last 1-2 months, and they have prepared a very nice quiz. So starting with Dr. Nitin Sherkar. He is Associate Professor in Department of Surgery at AIMS Nagpur, and he will be conducting the round of connecting the dots. Then we are having Rajvilas Narkhede. Volume, volume, music. So Dr. Rajvilas Narkhede is a practicing consultant surgeon and robotic surgeon at Max Hospital, and he will be conducting the round on super specialty. Then Dr. Soumya Ghoshal, he is assistant professor and Department of Trauma and Emergency at AIMS Nagpur, and he will be conducting obviously on a round on mystery in emergencies. Dr. Nirmal Patle is a senior surgeon, bariatric surgeon, and laparoscopic surgeon and director of Aureus Hospital. He will be conducting a preliminary round based on spot the diagnosis. Myself, Dr. Devish Saxena, I am working as associate professor here, and I will be conducting Ward Chale Hum, the allusion round, and the final rapid fire round. Dr. Mrinalini Borkar is not here. Her father's health is not good, but then she is coming. So she will be conducting a preliminary round on before knives are out. She is associate professor in Department of Surgery at IGMC Nagpur. Dr. Prachi Mahajan Madam is chairman of this quiz committee, and she will be conducting the audio visual round. She is a practicing surgeon and a breast surgeon at Mahajan Hospital, director of Mahajan Hospital, Nagpur. Dr. Vandana Tome Madam is working as associate professor in DMMC Savangi, and she will be debuting this time. She and Nirmal Patle both are debutant quiz masters this time, and she will be conducting the very first round of true or false. And we are having our veteran quiz master, Dr. Abdul Qureshi sir, who will be conducting the cryptic true rounds. He is professor and head Department of Surgery and Trauma at Government Medical College, Nagpur. So, can we have a big round of applause for all the quiz masters? So, as we have gone through these different editions of Bailey's to find out questions for you for the past 29 years, currently we are having this 28th edition of Love and Bailey. But still, as I already say, I have learned that I still have a lot to learn. Yeah, every time you read Bailey, something new comes up that we have not learned in the past. And as we are witnessing the 29th year of quizzing this year, we are eagerly awaiting for the 29th edition, which is supposed to launch by the end of this year. And our own Dr. Saoji sir has contributed a chapter on pediatric surgery in this volume. So sir will be joining us as a judge for this quiz. So you all are winners. Keep calm and love Bailey. That is the mantra. All the very best. On your mark, get set, go, and ready for the show. So I now invite qualifying round one teams. Team A. Who is team A? Yeah, please. Team B. Team C. Team D. Team E. And Team F. Team A. So Team A is GMC Yavatmal. Please occupy that one. That second. Team B is PDMC Amravati. Team C. Team C. Who is Team C? GMC Akola. Team C, GMC Akola. Team D, SET GS. Team D, SET GS. Team E, IGMC Nagpur. And Team F, AIMS Nagpur. So we welcome the judges for this quiz. Dr. Dubashi sir is here. He is professor and head and dean student welfare AIMS Nagpur. And Dr. B.B. Gupta sir is professor in surgery at NKP Salve Institute of Medical College. And we welcome the scorers and timekeepers, Dr. Prashant Savarkar, Dr. Tanmay Tapse, Dr. Rajiv Sonarkar, and Dr. Yeah. So please, so I now ask the team to please check your mic and at the same time, please introduce yourself. We will start with team A. Check the mic and please introduce yourself.
Hello, is it audible?
Yeah.
Myself, Pradima Rajurkar, representing Sri Vasudharao Nayak Government Medical College, Yavatmal. I'm Aditi Karu. I'm Shubda Thapre.
Yeah, team B from PDMC Amravati.
Hello. Hello. Good morning, everyone. My name is Abhinav Ravne. from Dr. PDMMC Amravati.
Myself, Shreya Sanav.
Myself, Yashashri Tat.
Good morning, everyone. I am Nandini Kulkarni from GMC Akola.
I'm Dr. Rajunath from GMC Akola.
Myself, Adina Seher from GMC Akola.
Hello, I'm Arya Prabhugaonkar from St. J.S. Medical College.
Usam Albari from St. Louis Medical College.
Shaitvi Bhanushali from St. James Medical College.
Hello, I am Tanmay Sepulkar from IGMC Nagpur.
Myself, Nakya Umretwala from IGFC Nagpur.
I am Nimisha Singh from IGMC Nagpur.
Please have a round of applause for all the participants.
Good morning, everyone. This is Dr. Gaurav Muhammad Purkar, intern at AIMS Nagpur.
Good morning, everyone. I am Nakul Yadav from AIMS Nagpur.
My name is Soumya Patibandi.
Okay. So we will be starting with first round, that is true and false. I now hand over the mic to Dr. Vandana Tome Madam, who will conduct her round. Amit?
Good morning, everyone. So now we are starting with the first round, that is true or false. Rules are like this. Each team will be provided with an envelope containing 10 questions, which have to be marked as true or false. Do not open the envelope until instructed to do so. Please write your team number as well as the name of college on the question paper and on the envelope. Time for solving these 10 questions is 2 minutes. Each correct answer will have 10 marks and -5 for wrong answers. After completing, keep the questionnaire back in envelope.
Number on the envelope. Do not open that. Write down your college name and team. Then now you can open the envelope. Your time starts now. Write completely true or false. Do not write B or F. Write completely true or false. In legible language. Right? And after you have written, after you have solved your question, write down the name of your team on the question paper also.
Now let's know the answers. And you all will know your score yourself, right? So the first question, chronic corticosteroid therapy accelerates wound healing by enhancing fibroblast activity. The answer is false. In fact, it reduces the fibroblastic proliferation and inhibiting collagen synthesis and suppressing the inflammatory response. Squamous cell carcinoma has a lower metastatic potential than basal cell carcinoma. It has a higher metastatic potential. Unilateral cleft lip is more common than bilateral cleft lip. Yeah, true. Damage control surgery aims to restore physiology than anatomy during the initial operation. And the answer is yes. Stopping bleeding and taking care of the contamination at the initial stage and later on doing the repair is the exam. Hungry bone syndrome commonly occurs after successful parathyroidectomy. The answer is true. An arteriovenous malformation is characterized by a direct communication between arteries and veins without an intervening capillaries. The answer is correct. It is an abnormal tangle of blood vessels where arteries and veins they meet directly bypassing the capillaries. Bone thickness burns are extremely painful. Answer is false. In a bipolar cautery, the current flows through the patient's body with cautery pad attached to cuff. That is false. In fact, it is between the two tips of the instrument. Clinical audit compares current practice with predefined standards to improve patient care. The answer is true. It is a quality improvement cycle. The last one, in fibrolaminar hepatocellular carcinoma, the alpha-fetoprotein levels are usually normal. Correct.
Thank you, ma'am. So you must have judged how much you have scored. So this is also containing negative marks. So now I invite Dr. Nirmal Patle for his round on spot the diagnosis.
A very good morning and welcome you all on behalf of ASN for this 29th surgical state level surgical quiz in the memory of late Dr. Indrajit Mitra. Myself, Dr. Nirmal Patle. I shall be conducting the round of spot the diagnosis. So this is the qualifying round 1. And in this round, this is what actually you will be seeing more or less. You will be shown one picture. It may be the rules I'll tell you. The image will be displayed and you will have to identify the condition or the diagnosis. The image will contain a clinical picture, an intra picture, or a diagnostic modality in the form of a CT or an MRI. There are 2 parts to each question. Each part will carry 10 marks. There will be 10 seconds allotted to each part. There is no negative marking and it is a non-passable round, right? So we'll start with the audience. So this is a CCT abdomen of a patient of blunt trauma abdomen. Look at the picture very carefully. You have to identify the spine injury depicted in the diagram. It has been very categorically shown with a curved arrow. Anybody from the audience, can they tell? Anybody from the audience? It's a wild guess. Maximum is you can be wrong. स्पाइन है फ्रैक्चर तो होगा, डिसलोकेशन होगा, कुछ तो होगा. No, I am afraid that is the wrong answer. You can see there is a lateral dislocation over T11 and T12. So there is a lateral movement of the vertebra one over the other. It is also known as a distraction injury. The question 2 for the same is patient underwent nephrectomy. Can you tell me which kidney was removed? This is a contrast enhanced CT scan. That's the clue. Left one. Why? Yes, there is non-enhancement of the contrast on the left side. So that left kidney is basically non-enhanced on the CT scan of the contrast CT. So that indicates that there is no blood supply to the kidney. So that is the reason the patient underwent left nephrectomy. And on the right side also you can see there is a upper polar, a part is non-enhanced, the rest of the kidney is enhanced. Right? So the patient has bilateral renal injury, left is non-functioning, so that had to be removed. So this is how it is going to be clinical based. You will have to identify the condition and the questions will be asked on that particular condition. Okay. So left kidney was removed. So let's start the quiz. First question will come to team A. Team A, identify this very classical sign.
Vital sign.
Vital sign. Correct. 10 marks to them. Right. So next is, what is the etiology of this? What is the reason of this vital sign?
Head trauma.
No, I want something specific.
Specific. Head clear.
Very classical description. You will find in the reason is very specific.
Cranial fossa.
It is basically the skull base. It is not the anterior fossa. It is basically the skull base. So 10 marks to them. The second part was not correctly answered. The score is 10 marks for this. Next is question to team B. This is an MRCP picture of a patient who has presented with obstructive jaundice. Look at the picture very carefully. Tell me the diagnosis of this condition.
Distended gallbladder with cholelithiasis stones.
No. That is the wrong answer. What do you see in that? So many. This is not a distended gallbladder showing the calculi.
Multiple cyst in liver.
Multiple cyst in liver.
Hydrated cyst.
Okay, give it to them.
Hydrated cyst.
Well, in time, I hope. I'll give it to them. They have answered the answer correctly. No. But within time, if they have attempted, I just want to know from the timekeeper where they were within the time to answer that question. Okay. So from the judges, we have got the very clear-cut instructions that the first answer has to be the only answer. Question. So this is basically a hydrated cyst which has got ruptured into the bile duct, and that is causing the obstructive jaundice. Very classical communication. You can see that there are multiple cysts. One of the cysts is connecting into the gallbladder CBD, and CBD is distended. Question 2. The same picture. Tell me what is PAIR.
Sir, it stands for percutaneous aspiration, injection, and reaspiration.
Okay, give it to them. So, big round of applause. They have answered one question right. So, this score is 10. Next question is for team C. See the picture. There is one arrow. Identify the medical device which has been pointed by the arrow.
Time is up.
Now you can guess, if even if you are not going to get it.
Trocar.
No, it is not a trocar. That's a classical corrugated rubber drain, a picture from Bailey, third chapter maybe. The second question pertaining to the same CRD is, tell me the working principle.
Positive pressure to negate atmosphere.
No. This acts on the capillary action, right? So no marks for them. We move to the team D now, question 4. Look at this picture. Spot the diagnosis. That is the wrong answer. It is not omphalocele. You have to be very clear. It is showing classical torsion testes on the right side. Right? Now you know the diagnosis. Tell me the complete treatment of this condition.
Is scrotal exploration. If the testis is viable, then orchidopexy. If the testis is found to be not viable, then orchidectomy.
I have mentioned therapeutic and preventive.
Preventive will be to fix the testes of the other side as well.
Very good. Give it to them. So right sided derotation and bilateral orchidopexy is the right answer. Team E. Patient of hematuria was being investigated. You can see the picture. Kindly identify the investigation.
So CECT.
CCT of what?
CECT of KUP, sir.
Okay, I'll give it to them. CCT, that is CT, basically urogram. But I'm happy if you said coronal section, but give it to them. CCT, KUP. Now tell me, what is the unit of tissue radio density on the CT scan?
So 15 HU, minus 15 HU.
Of radio density, any radio density, how to measure it?
Hansfield unit.
Yes, correct answer. So the answer is Hounsfield unit, right? So we move to team F now. Identify this surgical equipment.
Robotic surgical console. Patient site card.
Okay.
Equipment card.
Okay, I'll give it to them. It is basically the Da Vinci XI system, and the question was also the what is the name? Name the part A.
Surgical console.
Yes, give it to them. They are absolutely correct. So both the answers very correctly mentioned. Thank you so much. I invite next round is by Dr. Divish.
Thank you, Nirmal. And we have the So I will be conducting a round on what chale hum. Like school chale hum. Similarly, what chale hum. So the rules are, this will be the anti-clockwise round. So we will be starting with team F. Each team has to select a set from a grid that will be displayed to you. The team will get 20 seconds to answer option for 20 marks each. So you can earn 20 plus 20, 40 marks from this round. Our team will get only one attempt to answer. So whatever you are answering, make sure you are answering it correctly. Otherwise, we will move on to next question. Choose only one option. Avoid double answering. Otherwise, it will be considered as wrong answer. It is not a passable round. There will be no negative marking. And quiz masters and judges' decision will be final. So the idea behind creating round is based on different Oslerisms, as was stated by Sir William Osler. So why it is important for you not to stick to books and go to ward and see the patients is by his own statement, the whole art of medicine is in observation. But to educate the eye to see, the ear to hear, and the finger to feel, time and commitment. So this was the quote given by Sir William Osler. So we will start with the audience question. So audience, are you ready? Please wake up. So this will be the first question for you. An intern dressed the infected wound. The contaminated dressing should be discarded in which colored bin? Yeah, anyone? Anyone, please raise your hand. Do not answer in chorus.
Yellow bin.
Yellow bin is the right answer. You can give a chocolate to him. Answer is yellow colored bin. Now this one, the next question will deserve a bigger chocolate. If you can answer it correctly. Here is your question for the audience. You have seen this logo of biomedical hazard. The inner three interlocking shape represent host, agent, and what is the third one? Yeah.
Environment.
Environment. Okay, so I can grant it to you. It is mode of transmission. So very good. Please hand over a chocolate to him. So now we will be starting with the proper round. So since this is an anti-clockwise round, I will start with team F, that is AIMS Nagpur. Please select your set.
Set 1.
Set 1. So they have selected set 1. Let's see what is the question here. This in patient of ileostomy, something is being applied in the vicinity of stoma. What is being applied?
Silver paint.
Silver paint is the right answer. It is silver or aluminum or zinc sulfate, barrier dressing, whatever you can say. So next question to them. So they get 20 marks for this. Next question again to team F. In this image of stoma appliance, what does these circular rings, red arrow, represent?
Depending on the stoma pouting, we have to cut the inner circle of the stoma.
Very good. Very right. So it suggests cutting of the appliance according to the stoma diameter. Otherwise, you may impinge on the stoma. So absolutely right. Both the questions are right. Right. So now we move to team E is IGMC Nagpur. Your choice of set?
So set 5.
Set 5. So you want to play set 5. So let us see what is there. On post of day 5, the resident observed this red arrow in the midline laparotomy wound after opening the dressing. What is the likely complication?
So abdominal wound adhesions or burst
Okay.
abdomen.
So I'll grant it to them. It's a burst abdomen. Right. Absolutely right. So 20 marks to them. Next question again to team E. In this technique of temporary abdominal wall closure using sterile silo bag when the wound edges cannot be approximated.
So Bogota bag closure.
Bogota bag is absolutely right. So again, they will get full 40 out of 40 marks. So now we move on to team D. Set GS. Your choice of set?
Set 8.
Set
8.
8. So you have chosen set 8. So let's see what is there. What precaution one must take to prevent this complication, which is seen in the inset of urinary catheterization in a male patient?
To reposition the prepuce after inflammation.
Very good. So you have to reposit the prepuce back over the glands. So right. So they will get 20 marks. So the questions are easy. Good. Second question. The ideal agent for inflating Foley's balloon is option A, B, or C.
Distilled water.
Distilled water is absolutely right. So option C is distilled water. So again, they will get full 40 out of 40 marks. NS. Okay, so judges, whatever you say, we will consider. NS. So we will go by judges' decision. So they will get only 20 marks. Nothing to worry. There are not many questions coming ahead. So now we will move on to team C.
Set 3.
Set 3. So team C has chosen set 3. So here is your question. Post-procedural X-ray of patient showing some error in the subclavian line, which is shown by yellow arrow. What is the error?
Wrong catheter.
Catheter should be in right above right atrium. The placement.
Okay, I can grant it to them. The tip of the catheter is going up rather. It should go towards right atrium. So 20 marks to them. Right. So very rightly identified the error. Name this method of gaining access to central vein from the arm veins.
Peripherally inserted central catheter, PICC.
Absolutely right. So this is a PIC line, PICC line, peripherally inserted central catheter. So they will get full 40 out of 40 marks. Now we will move to team B. So your choice of set?
2.
Set 2. Okay. So here is this patient developed lower limb swelling for which a yellow ointment is being applied. What is the active ingredient of this ointment? You have to name the active ingredient.
Povidone.
Povidone iodine is the wrong answer. Anyone from the audience?
Magnesium sulfate.
Magnesium sulfate. So it is a sumac ointment and magnesium sulfate is there. Second question again to team B. Name this split commonly used in surgical ward for reducing edema by elevating limb.
Thompson spleen.
No, this is not a Thompson splint. Anybody from the audience? Oh, same person can't answer again and again. BB splint is the right answer. So you can hand over a chocolate to him. So BB splint or Bowler Brown splint is the right answer. So no, they have not earned any points. Right. So now last question to team A. Your choice of set. Please take your point.
Set 4.
Set 4. Okay. So here is your question. From 18th day of modified radical mastectomy, this patient presented with a bothersome swelling in axilla. What is the likely complication?
Probably due to axillary of clearance, lymph node clearance, leading to lymphedema.
Lymphedema. Okay, this is not lymphedema. So they will not get anybody from the audience. Very common complication.
Seroma.
Seroma is the right answer. So this is not lymphedema. Seroma. So they will not get any marks for this. But again, second question you can play. What is the principle in prevention of seroma with the drain shown here?
Negative pressure.
Negative pressure is the right answer. So they will get 20 marks for this. Okay. So here we finish this round. Mrinal madam is not here. So Mrinal madam is not there. So her round of before knives are out will be conducted by Dr. Soumya Ghoshal. So thank you. So Soumya, though he is presenting his round, but due to some emergency, Dr. Mrinal madam is not here. She will be coming. So he is conducting her rounds. So a big applause to Dr. Soumya.
So the name of the round is before the knives are out. So what is the meaning of that word, of that sentence? Before knives are out means we will deal with some investigation, some pre-operative things, right? So before knives are out, so my round will start from team A. So not team A, my round will start from audience first and then team A. So before that, I will state the rules. This is a clockwise round, I guess. From team A will, and each set will have 2 questions. And first question is based on some pre-operative procedure, as I said earlier, or any diagnostic modality. And the second question may be anything. Okay. So each team will get 15 seconds. Timekeepers, please 15 seconds, set the timer to 15. And to answer each question after answer. Okay, ma'am is here. So ma'am is not.
Sorry. It is fine. So we'll start with the round. The rules Up till now, I think you're clear. Each team will get 15 seconds to answer each question for 20 marks. So total, you can gain 40 marks out of this. Team will get only one attempt to answer each question. If the team is unable to answer the first question, the answer will be given by quizmaster or by audience. However, the second question related to the slide will be asked to the same team. If unanswered, it will pass to the audience. No question will be passed to next team. Is it clear? Everybody is clear? Okay, so can we start? Okay, so, and there is no negative marking. This is another important rule, so you can attempt. Okay. So this is an audience question. For audience, this is just a trial ball. So the type of questions which are going to be there. So what endoscopic investigation is this? Anybody from audience? Anybody? Just one audience question will allow.
Endoscopic ultrasound.
No, I'm sorry, it's a wrong answer.
Narrowband imaging.
No. So it is a little more advanced than narrowband imaging. It is the confocal laser endomicroscopy. So basically it is intravital microscopy of human gastrointestinal mucosa during ongoing endoscopy. So it's like a real-time optical biopsy. So it's a very new technique which is coming up nowadays. So this is the investigation which we are talking. Don't worry, the questions are not this hard. The questions are really easy. This is for the audience, okay? So one more question, few dyes which can be used. Anybody? Just one attempt we'll give. Somebody. Yes. No, actually the dyes which are used in this type of investigation can be fluorescein, acryflavine and crysyl violet. Few of them dye the nucleus, few of them don't. Okay. So this will be the type of question where you will have one question related to an investigation or a preoperative procedure, not necessarily an investigation always. So, and then there will be another question. Okay, so we'll start with the first team, team A. Okay, so this is the question for you. Name the investigation. You can look at the arrow and then name the investigation. Timer. It's they have did not answer it correctly also, and the time is up. So the answer is MR mammography. This is magnetic resonance mammography. Okay, it's not CT scan. You can see the image, which is a mammographic image. Okay, so okay, next question. So they get 0 mark for this. Next question goes to team A again. So what are the colored areas in relation to breast cancer treatment?
So, ma'am, these are the areas from which we can take flaps.
Yes, so that is a correct answer. So team A gets 20 marks for this. So basically, these are the areas of autologous. These are the autologous tissue options for breast reconstruction. Okay. So the next question is for, so team A gets 20 marks. Then next question goes to team B. Okay. So this is a micturating dye study in an 11 years old child with recurrent UTI. You can see a pre-void X-ray and a voiding X-ray. My question is, what is the diagnosis?
Vesico-ureteric reflex.
Yes, that is the correct answer. So they get 20 marks. It's bilateral vesico-ureteric reflux. Okay. So correct answer. So next question to team B. So this is correct answer. Okay. Name a treatment modality for severe vesico-ureteric reflux.
Colitano lead better technique.
Pardon, I didn't get you. Louder.
Colitano lead better technique.
No, I'm afraid that's a wrong answer. The answer is either subureteric Teflon injection or ureteric re-implantation. These are the procedures which can be done. So team B gets 20 marks because they answered one question correctly. Okay, so team C ready? So team C ready? Yeah. Okay. Okay, so should we give it? Actually, I could hear it. Or we give it? Okay. So I'm sorry. So team B gets a 40 marks for second question. Okay, so now, so team C has got a little more time for that question. So shall we ask this question? No? Okay, or we can just, I can ask. Okay. So name the investigation done in a 65 years old gentleman suffering from dyspepsia and retrosternal burning. Team C.
Manometry.
Yes. So that is the correct answer. Team C gets 20 points. So the answer is high resolution manometry. The next question to team C. What is the commonest cause of esophageal perforation?
Iatrogenic.
Yes, that is absolutely correct. So they get 40 marks. The most common cause of esophageal perforation is iatrogenic perforation during endoscopic procedures. Okay. So team C gets full 40 marks. Okay. Next question to team D. Name the scan in which the agent accumulates in the mitochondria of cells in a patient of hypercalcemia.
Technetium 99 Sesame scan.
Yes, that is the correct answer. So it is the Sesame scan. What is the condition? Can you just tell? You won't get marked for it. Okay, okay. So you won't get marks for it. So that's 20 marks they get. So next question is for team D again. What is the half-life of circulating parathormone?
3 to 5 minutes.
Yes, that is absolutely correct. So they get full 40 marks. So the correct answer is 3 to 5 minutes. So congratulations. Now we go to next team E. Okay. So team E ready? Yeah. So name this diagnostic procedure which talks about differential function of both kidneys. Name the investigation. Team E.
IVU.
No, I'm afraid that's a wrong answer. Anybody from audience? The DTPS scan. Okay. So next question still goes to, so they get 0 mark for this. Next question to team E again. Okay. Name an operation for treatment of pelvic junction obstruction in a child with a differential function of less than 40% on affected side. Team E. Operative procedure for PU junction obstruction.
Ma'am, urethroplasty.
No, I'm afraid again that's a wrong answer. It is for pelvic junction. So the answer is Anderson has dismembered pyeloplasty. Okay, so so team E gets 0 marks in this round. Now next we go to team F. So are you ready? So name this endoscopic diagnostic procedure done in a patient with persistent cough to assess mediastinal lymph nodes. Look at the diagram carefully and then answer. I want the investigation procedure which is being done.
It is endoscopic bronchial ultrasound guided biopsy.
Yes, very correct. So it is EBUS. So in other words, it is called, I mean, the short form endobronchial ultrasound guided needle biopsies can be done. Okay. So next question to team F. What is rat's approach to thoracoscopic surgery? What is rat's in respect to thoracoscopic surgeries?
It's robotic assisted thoracoscopic surgery.
Absolutely correct. So team F gets 20 marks. So total they get 40 marks. So this is brings to an end to my round. So I think we can do away with this round. I'll invite the next round below, please. Thank you so much.
Thank you, ma'am. So meanwhile, the scores are displayed. I request all the team members to please occupy your position in the auditorium and please carry the placards, the college placard along with you. And we will invite the teams for who are going to play qualifying round 2. So thank you, everyone. So qualifying round 2, team A. Qualifying round 2, team A, team B, team C, team D, team E, and team F. Your team. Team C. So team A is GMC Nagpur. Right? Team B is, yeah, round of applause for each and every team. Team B is GMC Gondia. Team C is Aurangabad, Chhatrapati Sambhajinagar. GMC Chhatrapati Sambhajinagar. Team C. Team D is JNMC Savangi is team D. Team E is MJIMS Sevagram. And team F is
NKP Sims.
NKP Salve Medical College Nagpur. So are we ready with the scores, Dr. Cable? So can you display the scores of previous round? Acha, wait. We will display it later. So let it be a history again. So you have already calculated your score, so you know where your team is standing. So again, we are going to start with qualifying 2 rounds. So you are now aware of how we are going to conduct this round. So first round, I hand over the mic to Dr. Tomeman. Yeah, please. Sorry, I mistake. So please, I request everyone to please check your mic and introduce yourself at the same time. So we will start with Team A, GMC Nagpur.
Good morning to one and all present here. I am Dr. Ashutosh Dubey, intern from GMC Nagpur.
Myself, Padnavi Barke from GMC Nagpur.
Myself, Oma Avalkar from GMC Nagpur.
We are team GMC Gonda. I am Rajnandini Singh.
Myself, Komal Bafna.
Myself, Harshit HPM.
Good morning, everybody. This is Dr. Chinmay Kulkarni, intern from GMC Chhatrapati Sambhajinagar.
Good morning. I'm Dr. Mayuri Fute from GMC Chhatrapati Sambhajinagar.
Myself, Vikas Singh, final year MBBS students. Good morning, I'm Dr. Aditya Laturia from JNMC Savangi.
I'm Dr. Sanvi Arora.
I'm Dr. Hansika Banchor.
I'm Dr. Nikish from MJMS Sevagram.
Myself, Ansu Ranjanu from MJMS Sevagram. Myself, Varun Daga from MJMS Sevagram. Myself, Vedan Saraf from NKP Sims.
Dr. Arjun Jiskar.
Myself, Dr. Jatin Kalansi.
So we are starting with this round, and I think you know the rules, but I'll repeat them again if anyone has missed. Each team will be provided with an envelope containing 10 questions, which have to be marked as true or false, and write completely, just don't put T or F. Do not open the envelope until instructed to do so. Please write your team number as well as name of college on the question paper and on the envelope. Time for solving these questions 10 questions is 2 minutes. Each correct answer will have 10 marks and -5 for wrong answers. So negative marking is there. After completing, please keep the questionnaire back in the annual. Okay. So each one of you has written your team name and number. Okay. Now you can open your annual. Time starts now. Yeah, last 30 seconds. Now we will see the answers so that you know your score yourself. Collagen synthesis is predominantly associated with proliferative phase of a wound healing. The answer is true. It helps in remodeling and maturation. Feeding difficulties are more common in an isolated cleft lip than in isolated cleft palate. The answer is false. An opening in the roof avoids the suction mechanism which is needed for breastfeeding or feeding. Chronic pancreatitis significantly increases the risk of pancreatic carcinoma. Long-term inflammation and tissue damage. Preoperative carbohydrate loading in selected patients reduces postoperative insulin resistance. IRAS reports. Randomization helps reduce selection bias in clinical trials. An ankle brachial pressure index, ABPI, greater than 1.3 indicates severe peripheral arterial disease. 1 to 1.4 is supposed to be normal, and less than 0.4 is severe. Caudate lobe of liver corresponds to segment 8 of Coinet's liver segment. This segment, correct segment. The carotid sheath contains the common internal carotid artery, internal jugular vein, and phrenic nerve. Is the vagus nerve. Gastrographin is a water-soluble iodinated contrast dye. In carpal tunnel syndrome, Ulnar nerve is most commonly involved. This the median. Thank you.
Now I invite Dr. Nirmal for a round of water diagnosis. Can we have the audio video? Okay. Qualifying round 2. Best of luck, all the teams. This is again the spot the diagnosis round where you will be given one image. You have to identify the image and answer the questions pertaining to it. So these are the rules. An image will be displayed. You have to identify the condition and claim the diagnosis. Each question will have 2 parts, 10 marks for each part, total 20 marks, 10 seconds for each part, no negative marking, non-passable, and you have got only one attempt to answer that question, right? So we start with the audience. Are you ready, audience? This is an intra picture of a laparoscopic procedure. There is an arrow there. Kindly identify the organ. Can anybody? Yes.
So, liver.
The liver is just besides it. It is a wrong answer. Anybody else want to give it a try? Liver is just besides the organ.
Gallbladder.
No chorus answers, please.
Gallbladder.
Spleen.
Spleen, yes, that is a spleen. This is an enlarged spleen. The next part is what is the commonest site of accessory spleen? Let the audience answer. Very
Hilum.
Yes, correct. Give him a chocolate. So splenic hilum is the commonest site of accessory spleen. So are we ready, team A? Over to you. This is an intra picture of a Lichtenstein repair for a right inguinal hernia. Look at the picture very carefully. Identify the structure which is being held with the fingers. Rectus sheath. Inguinal hernia, where is the rectus sheath there? Okay, intra. You can very well see that it has been very clearly dissected. It is basically the hernial sac. Simple. It cannot be more simpler than this. Next part. Carefully look at the arrow now. Identify the instrument pointed by the arrow. Classical. What is it being held with the arrow? No, it is not a Babcock forceps. It is a anybody from the audience? Yes, cord holding forceps. So it's an inguinal hernia repair. The sac is between the two attached ends of the cord. Can anybody answer from the audience which kind of hernia it is? This is a right inguinal hernia. The sac is between the two points of attachments of the cord. Can you tell the type of hernia? Okay, so the sac is medial to the deep inguinal ring. Now tell me. Okay, team B. What is this is a patient who has presented with perforation peritonitis. Look at the arrow there. Identify the sign depicted. Timer. Yes. Very classical description in Bailey. No, it is no. It is not a cascade sign. It is Rigler's sign. Part 2. What is the commonest cause of perforation peritonitis? Yes, I'll give it to them. 10 marks.
Hello.
Yes.
Hello.
Okay. Next question to team C. Identify the tube.
Laryngeal mask airway.
Very good. Give it to them. Or also known as supraglottic airway. Pertaining to the same, which type of endotracheal tubes are used for single lung ventilation?
Double lumen.
Good. Excellent answer. A double lumen tube is used for single lung ventilation. Next question is to question D. This is again an MRCP picture of a patient of cholangitis. There is the arrow very categorically pointed to a particular thing. Spot the diagnosis.
CVD stones.
Very good. It is choledocholithiasis. What is the treatment for this?
ERCP.
Yes, I'll give it to them. ERCP or a CBD exploration is the correct answer. So we move to team E. Look at the picture. 35-year-old female presented with acute pain in the right breast. Name the condition.
Mondor's disease.
Good. The teams are answering very well. So happy for them. What is the differential diagnosis?
So Mondor's disease is thrombophlebitis of the chest veins. So
asking
it can
about
also be
differential.
Teat syndrome.
No. Wrong answer. It is the lymphatic permeation from CA breast which can mimic this condition. Team F. See the diagram very carefully. Identify the surgery.
Sleeve gastrectomy.
Good. Which type of bariatric surgery it is?
Restrictive type.
Give it to them. 20 marks for them. Right. Thank you so much.
Thank you, Nirmal. So we will be starting with next round, that is what chale hum. Can we have the display? Yeah. So you have already seen what chale hum qualifying round 1. So the questions will be similar. So it will be again, I will conduct this anti-clockwise. So I will start with team F. Each team has to select a set containing 2 questions from the grid displayed. The team will get 20 seconds to answer for 20 marks each. So 40 marks to score. Only one attempt to answer. So avoid double answering. It is not a passable round. There will be no negative marking, and quiz master's judges' decision will be final. So continuing with oscularisms, again the second quote, very important. Listen to your patient. He is telling you the diagnosis. Again, this quote is given by Sir William Osler. So that is why it is important to go to wards, see to your patient, listen to their history, and then most of the time the diagnosis is decided on history. So we will come on to audience question. Audience, are you awake? So this is the question for you. This patient of burst abdomen with controlled fecal fistula, a device has been applied for daily hassle-free management of the wound. Identify this device.
Wound manager.
Wound manager is the right answer. So please hand over a chocolate to him. So the answer is abdominal wound manager. So next question again to audience. Identify this technique of anterior abdominal wall closure. Yeah, that gentleman.
Tension band repair.
Tension suturing, yes. So give a chocolate to him. So right answer. So now we move on to the teams. So we will start with team F is NKP Salve. Yeah. So your choice of set?
Set 6.
Set 6. So they have chosen set 6. So here is your question. For proctoscope, what is the name of inner part of proctoscope as marked by question mark?
It's an obturator.
Obturator is the right answer. So they will get full 20 marks for this. So next question. Identify this instrument used to treat common condition presenting with bleeding per rectum on OPD basis. Seven seconds, 6, 5.
It's a banding device.
It's a banding device, right? So I will give it to you. So this is the Baron banding apparatus. So they will get full 40 out of 40. Team F NKP Salve. So now my question goes to Team E MGIMS Sevagram. Your choice of set?
Set 7.
Set 7. So they have chosen set 7. So here is set 7. A resident is doing a bedside maneuver for difficult airway assessment in this patient. What is he testing? Upper lip bite test. No, I'm sorry, I can't give it to you. Anyone from the audience? Yeah, ma'am. Jaw protrusion is right answer. So she will get chocolate. So jaw protrusion. So he's testing jaw protrusion, not biting. Right. So second question again will be directed to MJMS Sevagram. So here is your question. On mouth opening, only soft and hard palate are visible. What is the grade of modified Malampati scoring?
Grade 3.
Grade 3 is absolutely right. So they will get, so that the mnemonic you can remember is push. So push, push, sh, and h. So soft palate, hard palate, palatine tonsil, and uvula. Right. So they will get 20 marks, right? So now my question is to team B is which college?
Set 3. JNMC Savangi.
Sabangi. So you have chosen set 3. Set 3. So they have chosen set 3. Okay, so here is your question. Patient of total thyroidectomy came for suture removal. The intern informed that the sutures are at the end of the suture line only. By yellow circle, you can see. Name the suturing technique. You have to name the suturing technique.
Subcuticular.
Subcuticular is right. So subcuticular sutures is the right answer. So they will get full 20 marks. Again, question 2 to team D. The patient came after 1 month post laparotomy with bothersome nodule and discharge from lower end of the scar. You can see it by yellow arrow. And it was removed surgically, which can be seen in the insert. What is the likely diagnosis?
Scar disease.
So, anybody from the audience? Anybody from the audience? Anyone else?
Suture granuloma.
Who said?
Suture granuloma.
Audience. Okay, suture granuloma is the right answer. So it is a stitch granuloma. Right. So a chocolate to him. So you are collecting too many chocolates now. Okay, so now my so they will not get any marks for this. Okay, so 20 marks. You have answered first one correctly. To team C. Team C is GMC Chhatrapati Sambhajinagar. Okay. So your choice of set?
Set 5.
Set 5. Okay. So here is your question. Post MRM patient on adjuvant chemotherapy, a subcutaneous tubular structure by arrow you can see can be seen. What is it? Team C.
Sir, chemoport.
Chemoport is right answer. So the patient has showing us the chemoport placement here. So 20 marks to them. Next question again to team C. Post breast cancer treatment, this patient developed lymphangiosarcoma at right arm. This syndrome is better known as
Stewart-Travis syndrome.
Stewart-Travis syndrome is right answer. So they will get full 40 out of 40 marks. Now we move on to team B, that is GMC Gondia. Your choice of set?
Set 4.
Set 4. So here is your question. A resident while doing dressing notices greenish yellow stained pads and gauze over infected leg ulcer. Likely microbe associated with this wound is?
Pseudomonas.
Pseudomonas is absolutely right. So that means you are going to ward. Good, very good. I am very happy. So now tell me the next question. So they will get 20 marks. The likely solution for cleaning the previous wound out of these solutions, which one will you pick? A, B, or C? First answer will be considered as your answer.
Povidone.
Povidone iodine is wrong answer. Anybody from the audience? vinegar or acetic acid, okay, especially for Pseudomonas. So the answer is acetic acid. So they will get only 20 marks, right? So we move on to GMC Nagpur. Your choice of set? Set 8. So they have chosen set 8. A patient due for removal of small epidermoid cyst over scalp developed this lesion, yellow circle, on forearm 20 minutes prior to scheduled procedure. What it could be? Hypersensitivity is the right answer to local anesthetic. Very good. So they get full 20 marks. Second question again will be to team A. This topical numbing cream, AMLA, used for children, consists of lignocaine and what is the second drug? You won't be able to read it. I have already asked it. Aspirin are taken from atropine. Atropine. No. I'm sorry. It is not the right answer. So the right answer is prilocaine, right? So they get only 20 marks. So thank you again for playing this round. And now I invite Mrinal Madam for her round.
We're back with the round, that is before knives are out. So before any surgery, whatever is done will be asked in these rounds. Okay. So you have seen the first round, so you know first qualifier. So let's quickly go through the rules once again. It's a clockwise round. Each set will have two questions. First question based on some pre-operative procedure or diagnostic modality. Second question may be each team will get 15 seconds to answer each question for 20 marks. So total 40 marks. A team will get only one attempt to answer each question. If the team is unable to answer the first question, the answer will be given by quizmaster or audience. However, the second question will also be asked to the same team, and it will also unanswered will pass to the no question will be passed to the next team, and there will be no negative marking. Okay. So let's do one question for the audience quickly. So this is a post ESWL X-ray of KUB region and patient presented with retention of urine. Can anyone tell me the diagnosis? Anybody? No role of conventional X-rays, it seems. Okay, so I'll give the answer. The answer is there is a calculus in the prostatic urethra if you see carefully. So that's the reason why the patient went into retention. Okay, so now next question is what is the treatment of a calculus impacted in posterior urethra? Anybody? Nobody interested in urology, urosurgery? Okay, so I'll give the answer once again. It's pushing it back to bladder and removing it later from bladder. Okay, so that was just a warm-up question. So I hope you all are ready. So we'll start with team A. Okay, so name the investigation done in a 65-year-old gentleman, hypertensive, with blackish discoloration of great toe. Please look at the picture carefully and then give the answer. I want the investigation which is done. I'm afraid that's a wrong answer.
It's a digital subtraction.
Yes, but you answered it in the second attempt. I have already told that will only get one attempt. So it is a digital subtraction angiography because you're not any bony structure or anything. And then so team A will get 0 mark for this question. although they get the chance to answer the next question. So name the autologous vessel which can be used for femoropopliteal bypass surgery. Yes, louder, you can use the mic properly.
Great saphenous vein.
Yes, that's absolutely right. So the answer is you can use great saphenous vein, short saphenous vein, arm veins also. So that's the correct answer. So team A gets 20 marks for this round. Now team B ready? Okay, so this is the question for you. Name the procedure depicted in this picture in case of severe head injury. You can see a procedure that is being done and you see the picture carefully and then answer. You have to name the procedure.
EEG.
I'm sorry, that is a wrong answer. Anybody from the audience? Pardon? No. You can see a pressure monitor attached to that.
It is for measuring intracranial pressure.
Yes, it is the intracranial pressure monitoring. So team B will get 0 mark for this question. Next question for team B. Name a drug used to reduce increased intracranial pressure.
Mannitol.
Yes, that is the right answer. So that was probably an easy question, or you made it look easy. Okay, so congratulations, they get 20 marks in this round. So the answer is mannitol, hypertonic saline, or simple procedures like raising the head end of the patient, giving pre-oxygenation, all these can be used. Okay. So next question is for team C. Ready? Okay. This is a 99 technetium scan in a child with abdominal pain and hematochezia. What is the diagnosis? I want a complete diagnosis. Please look at the picture carefully and then answer.
Diverticulosis.
No, I'm afraid that is the wrong answer. I have made it specifically. It's for in a child. Anybody? Meckel scan. You can see the Meckel's diverticulum with heterotrophic gastric mucosa. So you can see the stomach as well as the Meckel's point also. So intraoperatively, second question to team C. Intraoperatively, the patient had wide-based Meckel's diverticulum with induration near base. What is the surgical treatment of such Meckel's diverticulum? Team C.
Resection and anastomosis.
Yes, absolutely correct. So they get 20 marks for this. So there is no role of just cutting the diverticulum or invaginating it. The answer is resection and anastomosis of the bowel. So team C gets 20 marks. Okay. So next question is for team D. Team D ready? Okay. Now name this endoscopic investigation done in a 65-year-old male with gastric outlet obstruction. Six.
Endoscopic ultrasound.
Yes, that is a correct answer. So I'll give it to them. It is endoscopic ultrasonography. Okay, you can see the irregular mass also. Then next question to team D. In gastric cancer, listen carefully. Which minimally invasive investigation can detect peritoneal metastasis so as to avoid a laparotomy? Please read the question and then answer.
Laparoscopy.
Yes, I'll give it to him. It is the diagnostic laparoscopy is one. It's an investigation. It's an operative procedure, but an investigation which can avoid a laparotomy if multiple peritoneal metastases are found. So team D gets full 40 marks. Okay. Now we go to team E. Ready? Name the radioactive agent used in this investigation in a patient of multinodular goiter.
Iodine 123.
Yes, that is a correct answer. Can you tell me any other dye which can also be used? You will not, your marks will not be deducted.
Technetium 99.
Yes, so that's the correct answer, but no bonus marks for this also. So these two drugs can be used. So next question for team E. What is block and replace regimen in treatment of hyperthyroidism? you block something and replace it. So that time is already started. It's 10, 9.
First, we give the anti-thyroid drugs and make the thyroid euthyroid, and then we go for radioiodine frequency ablation or thyroidectomy. The drug used is propranolol.
Let's see. Giving anti-thyroid drugs with thyroxine. That is what he has said actually. So I'll give it to him. It is the E team. He gets 40 marks for that. So next question is for team F. Are you ready?
Yes, ma'am.
Okay. So this is investigation done in a patient of pelvic trauma with blood at meatus. What is the possible diagnosis?
Urethral trauma.
Yes. So I can give it to him actually. It's urethral rupture, urethral trauma with urethral rupture. We can see the extravasation of the dye through it. Okay. So they get urethral injury with extravasation of dye. So team F gets 20 marks for it. So next question is for team F again. This is your second question. What is VIU in treatment of short non-traumatic bulbar urethral strictures in relation to this? What is this word means? VIU.
Video insisted urethroplasty.
No, you were after the timer buzzer also was given, and it is visual internal urethrotomy. It's not urethroplasty also. So I'm sorry, I can't give it to you. So team F will get 20 marks in this round. So this brings us to the end of this round. So I think next round, these teams can leave, and the teams for next round can come on the stage.
Thank you all for playing the qualifying round 2. I request all the team members to please have a seat in the audience. Please take your placard. EMC Modia, please take your placard. So now I invite the 6 teams for qualifying round 3. So team A, B, C, D, and E who are going to play qualifying round 3, please come and occupy your position at the dais. So team A is from Jalgaon. Team B is from Datta Mega Medical College, Nagpur. Team C is from GMC Vidisha. Team D is from EJMC Pune. Team E is GMC Chandrapur, and Team F is GMC Nanded. So I invite Dr. Tome Madam for her rounds on true and false.
Go on, please introduce yourself and by saying and check the mic codes.
Good morning, everyone. I am Dr. Khushi Surana, and we are representing Dr. Ullas Patel Medical College, Jalgaon.
Hello, I am Dr. Varada from Dr. Ullas Patel Medical College, Jalgaon.
Good morning, everyone. Myself, Dr. Rahul Jain from Dr. Ullas Patel Medical College, Jalgaon.
Morning, everyone. Myself, Shadorle from DMMC Nagpur.
Good morning, everyone. I am Nusrat Thanawala from Datta Megi Medical College.
Good morning, everyone. I am Asiya Pathan from DMMC Nagpur.
Good morning, everyone. We are representing GMC Vidisha. I am Dr. Toshija Adil.
I am Dr. Niharika Garg.
I am Dr. Richa Singh.
We are Team BJGMC. I am Himanshu Sadalwad.
I am Aditya Virangane.
So Purvi Lahoti.
I'm Mayank Chaudhary from GMC Chandrapur.
I'm Dr. Ankita Pandey, intern from GMC Chandrapur. I am Tanvi Mawar from GMC Chandrapur.
Good morning, everyone. Myself, Arpita Mahota from Dr. SCGMC Nanded.
I am Kunal Kulkarni.
Myself, Sumit Sovitkar.
We have a wildcard entry. So I invite GMC Bhandara team. They are not students of GMC Bhandara, but then for fun, they will be playing the quiz this time, but they are not qualifying for the next round. So they will be just playing for fun. So everybody agrees? Yeah. So I invite the team from GMC Bhandara. You will be playing as Team H. Where is the third member? Call him fast. You come and call him or her. Call them. So can we have another placard of Team H? Team G. Okay, so they will be representing Team G. So they will be playing for sports, but they will not proceed to next round. I request everyone to please write down your college name and team number on the envelopes. Please write, do not open the envelope. Please write down your college name and your team number. Team A, B, C, or D. Ma'am, please.
Now, since this is the third round, you are well aware of the rules, but I'll again repeat. So each team will be provided with an envelope containing 10 questions, which have to be marked as true or false. You have to write completely, not only T or F. Do not open the envelope until instructed to do so. Please write your team number as well as name of the college on the question paper and on the envelope. Time for solving these 10 questions is 2 minutes. Each correct answer will be given 10 marks and minus 5 marks for the wrong answer. So negative marking is there. After completing, please keep the questionnaire back in the envelope. Everybody has written on the envelope team number and name. The newly, where is the third person? Can we start or we have to wait? We can start. The time starts now. One minute left. Thirty seconds left. Stop writing. Team C. Put it back in the envelope. Team B. Okay, now that have the answers so that you know your position. A normal blood pressure excludes significant blood loss in young trauma patient. Granted, cause usually if it is more than losses more than 30%, then only it is seen. Recurrent laryngeal nerve is more common than superior laryngeal nerve injury during thyroidectomy. The answer is correct. We don't have much literature regarding superior laryngeal nerve. Serum lactate is a useful marker of tissue hypoperfusion in shock. The answer is true. Most common cause of primary hyperparathyroidism is single parathyroid adenoma. Beneficence require clinicians to act in a patient's best interest. True. Keratoacanthoma is self-healing nodular lesion with central ulceration. The answer is correct. Shoulders repaired hernia is classified under hernioplasty surgery. It's wrong, false. In lumbar sympathectomy, L1, L2, L3 sympathetic ganglia are removed. It is wrong. We preserve L1 to prevent sexual dysfunction and ejaculatory functions. Iodine F131 emits both beta and gamma rays, where beta rays cause thyroid destruction. It's true. In surgical procedures, notes, that is NOT, is the entry point is through umbilicus. The answer is wrong. Natural orifices like transgastric, transvaginal, not transcystic. Thank you so much.
Thank you, ma'am. Meanwhile, we will just have a formal introduction from Team G from GMC Bandara. Please introduce yourself.
Good morning. This is Sakshi Devkar from GMC Bandara.
My name is Tushal Patle from GMC Bandara.
Myself, Shantanu Dhande.
Thank you.
Again, welcome you all for this qualifying round 3. All the best teams. This is the round of spot the diagnosis. Here you will be given shown an image and you will have to identify the condition or the diagnosis. Each question has 2 parts, 10 marks for each part. Total 20 marks are there to be scored. 10 seconds for each part, no negative marking, non-possible, and you have to answer it in a single attempt. We start with the audience now. Identify the landmark. Can anybody? Great. So this is a very easy carcinoma triangle of Passaro. Investigation to localize this tumor. Dotatic scan. I'll give it. Gabalimab, it is a somatostatin analog, so that the pets can give it to him. Chocolate for him. So we start with team A. This patient presented with constipation, vomiting, abdominal distension. Look at the X-ray and identify the surgical emergency in this patient. I want the diagnosis. Surgical emergency condition.
It is distal bowel obstruction.
Okay, give it to them. It is intestinal obstruction. Now look at the arrow. Look carefully. What does the arrow depict? What procedure has been done? Can you see something there?
Hartmann's procedure.
No, look at there. There is a foreign body there. You can see that the stent is there. So this is colonic stenting has been done for a probable diagnosis of a CA descending colon with intestinal obstruction, right? So they get 10 marks. Team B, be ready. A patient in supine position, bilateral leg raising revealed the following finding. Can you tell me what is the diagnosis?
It is a tumor which is fixed to the rectus.
No, 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 no. It is not that. It is a classical case of divarication of recti. How will you treat this surgically? Which procedure is done? Give it a try. Okay. Time up. You do plication. Simple. Right? Over to team C. Look at this picture. Identify the condition.
Phimosis.
No, wrong. Totally wrong. This is bilateral undescended testes, also known as cryptorchidism. You don't see the testes there. Okay. So tell me, why is this not a bilateral retractile testes? Okay. So the answer is the scrotum is actually not developed. So it is basically a it cannot be a non retractile testis because in that case the scrotum is developed. Team D. So they don't get any marks there. Team D. Look at the picture. Name the endoscopic procedure being performed.
Tips.
No. It is basically a mediastinoscopy. What it is used for? Now tell me.
To visualize lesions of the mediastinum or mediastinal tumors.
I want a better answer. Scopy is for visualizing. You can easily say. You get lymph node biopsies from them, right? Team E. Look at this picture. A patient of CA rectosigmoid junction with intestinal obstruction underwent this procedure. Can you identify the procedure which has been performed? Look at it carefully. There is some tube-like structure over the red thing which you see.
Ileostomy.
No. I specifically marked the right costal margin there. I cannot give it to them. It is a transverse loop colostomy, right? So now tell me, where is an ileostomy commonly fashioned?
Uh, Above the umbilicus gastric.
No, 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 no. It is in the right iliac fossa, right? So they don't get any marks for that. Over to question. Team F. This is an intra image of a laparoscopic cholecystectomy. Name the technology which has been used here. Special technique. Time up. Very classical indigo cyanin green imaging, right? Now, what is the medial border of Calot's triangle? Theoretical. Tell me.
Common hepatic duct.
Okay, good. Give it to them. So 10 marks. Team G. Are you ready? Debridement of leg has been done, exposing the calf muscles. All the layers above the calf muscles have been removed. So, identify the primarily infective condition the patient is suffering.
Cellulitis.
No, I cannot give it. You don't remove tissues to up to the calf muscles for that. It is basically necrotizing fasciitis. right? Now, what is NPWT or VAC? Simple.
Negative pressure wound dressing or vacuum stimulation.
Okay, I'll give it to them 10 marks. Negative pressure wound therapy or vacuum assisted closure. So that with that we come to the end of this round. Thank you so much.
Thank you, Nirmal. We will be conducting next round. Can we have the display, please? Yeah, so this again, you are aware of this round, that is board chale hum, right? Please check your mic once. Most of the time your voice is not audible to the audience. Please check it once.
Hello, hello,
Hello.
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 Hello. Hello.
Team B,
hello, hello.
Team C, Team B, Team A, Team G. So we will be starting with this round. So you are already aware of the rules. So we will be starting it in an anti-clockwise manner. So team F, I will start. So you will have only one attempt to answer. Avoid double answer. It is not a passable round. There will be no negative marking. So again, continuing with Oslerisms. So you have already gone through two quotes of William Osler, and this one is the very important quote. He who studies medicine without books sails an uncharted sea, but he who studies medicine without patients does not go to sea at all. Okay, so that's why it is important to go to your wards, respective wards, and see the patients. So again, the audience question. Audience, are you ready? Yes. So here is your first question. It's a framework of 5 moments of hand hygiene by WHO, which is shown here, which is the fifth one. So you can see before touching, before aseptic, after fluid exposure, and what is the fifth one?
After
Audience.
touching patient surroundings.
Yes, patient surrounding. That is the correct answer. After touching patient surrounding. So a chocolate to him. So next question again is for audience. So in the spill management protocol, what solution is poured over the spill as shown in step 4? You can see that question mark with red box.
Hypochlorite solution.
Sodium hypochlorite is right answer. So again a chocolate to him. So right answer is sodium hypochlorite. So now we will move to team proper. So here are your sets. So we will start with GMC Nanded, team F. What is your choice of set?
Set 4.
Set 4. So they have chosen set 4. Let us see what is there. Name this technique used for soothing and healing of common perineal and perianal condition.
Sid's bath.
Sitz bath is the right answer. So next question again to you. This patient has an external opening of fistula and ano at 11 o'clock position, approximately 2.5 centimeters from anal verge. According to Goodsall rule, the likely position of internal opening will be at?
Along the straight line and the same.
Right. So I'll give it to you. So it will be straight track 11 o'clock. So any swelling more than 3 centimeters away may have a curved track. Right. So full 40 marks to them. Now I move to team E, GMC Chandrapur. Your choice of set?
5.
Set 5. So you have chosen set 5. Let us see. An intern noted typical attitude of fingers and wrists while taking BP of this patient who underwent total thyroidectomy 3 days back. What does it signify?
Trossosine.
Troziosine is absolutely right. So hypercalcemia or troziosine is right. So 20 marks to them. The next question is, an undergraduate noticed the suture line over forearm in an operated case of total parathyroidectomy. What does it signify?
It's placement of the parathyroid gland over the brachioradialis muscle.
Very good. Absolutely right. So full 20 marks to them. So full 40 marks. So it is a parathyroid autotransplantation in the forearm. So next is team D. Your choice of set?
Set 7.
Set 7. Okay, so here is your question. While attempting urethral catheterization twice in a patient of suspected pelvic fracture, the resident encountered this scenario. What should be done now for monitoring urinary output?
Suprapubic catheterization.
Very good. So suprapubic cystostomy should be done. So absolutely right. So they will get 20 marks. Next. After prostate surgery, the preferred perurethral catheter will be option A, B, or C. Give only one answer.
A.
Option A is absolutely right. So triluminal silicone catheter for draining as well as for irrigation. So they get full 40 out of 40. Now team C. So team C, your choice of set?
Set 8.
Set 8. So they have chosen set 8. So here is your question. This patient due for a Whipple surgery is shifted to OT with these things wrapped on both legs. Identify the device.
Pneumatic compression stockings.
Very good. For prevention of?
Deep vein thrombosis.
Right. So very good. So it is a DVT prevention garment. So 20 marks to them. Now next question again to team C. An intern is observing the X-ray abdomen of this patient, a known case of DVT. What does that yellow circle shows?
Greenfield IVC filter.
IVC filter is absolutely right. So again, full 40 marks to them, team C. Now we will move on to team B. Your choice of question?
Set 1.
Set 1. So they have chosen set 1. So here is your question. An intern showed this blood component and wants to store it in what refrigerator? Where should he keep it in fridge? Site A, B, or C? Only one chance.
Site A.
Site A is right. So he or she should keep it in a freezer. Right. Very good. So now next question again to team B. Identify this special blood component technique or bag that can increase platelet count to 20,000 to 50,000 microliter with a single infusion.
Fresh frozen plasma.
No, I'm sorry, this is wrong. The question passes to audience. Who said single donor? Yeah, so please give a chocolate to him. So this is a single donor platelet technique. Okay, so RDP increases just by 10,000 or less than 10,000, sometimes 8,000, but it increases 20 to 50,000 SDP. So they get only 20 marks for this. Now we move on to team A. Your choice of set?
Set 6.
Set 6. Okay, so here is your question. A patient had an endoscopic guided placement of tube through nose for feeding purpose. Identify the procedure. Last 6 seconds.
Endoscopic guided feeding tube.
No, I want the answer. So I can't give it to them. So anybody from audience? So that is already been asked in the question. So sir is right. It is nasojejunal feeding. So this is called as an NJ tube, right? Okay. So second question again to team A. Another patient of unresectable carcinoma esophagus who went an endoscopic procedure for feeding tube placement. Identify the procedures.
Feeding gastrostomy.
Can you elaborate it more?
Feeding endoscopic guided feeding
Okay, I can
gastrostomy.
grant them to it. So it is endoscopic, percutaneous endoscopic gastrostomy. Right. So 20 marks, just 20 marks for them. Okay, so now we move on to team G. Yeah, your choice of set?
Set 3.
Set 3. So they have opted for set 3. And intern notice this mark, you can see on yellow arrow, on forearm of a patient to be taken inside OT for hernioplasty. What is its significance? Shh, please. Audience, please. So your time is up. Anybody from the audience? So it is a pre-operative site marking. Which side of hernia you want to operate? That can be marked so that you should not operate on the wrong side. Okay, so left hernioplasty. So patient's left side it is marked. So no points for them. Next question again to team G. What is the treatment of choice for removal of hairs prior to surgery? So you are having only one option.
A.
Option A is right. So clipper. So hair clipping. So clipping should be done for preoperative hair removal, right? So they get only 20 marks. So thank you everyone for your patience and playing this round. I call Dr. Pranal Madam for her round.
So I hope all of you are enjoying the quiz. So this is, I think, the last round of the qualifiers. Okay. So my display, please. Just small question to audience. Can you, I mean, tell the, I mean, why all these names are there? They're all detectives, isn't it? So we also work sometimes like we have to work like a detective to find out the diagnosis. So we also hunt for various clues and then we reach to the diagnosis, the culprit we find and then we treat it. So the before the knives are out, we all are detective. Okay. So let's begin the rules again very quickly, clockwise, starting with team A and team B will be that. Okay. So each set will have two questions. First question on some preoperative procedure or diagnostic modality. Second question may be any. The team will get 15 seconds to answer each question for 20 marks. Total team will get only one attempt to answer the question. Team is unable to answer the first question. The answer will be given by quizmaster audience or this. However, the second question will be asked to the same team. If an answer, it will pass to. No question will pass to the next team. There is no negative marking. Okay, so all are clear. So let's begin. There is one question for the audience. You can see three pictures here where there are multiple people and you can make that they are all doctors and they are discussing something. What type of meeting is this? Can anybody tell me? Multidisciplinary team meeting. Yes. So that is a very important pre-operative procedure which is followed. So a chocolate to that person. So where all the members from all the departments like the pathologist, radiologist, everybody sits and discusses about the diagnosis and treatment. Okay, so let's begin. Team A, are you ready? So the next question is for you. Name this diagnostic procedure done in a patient who is having perianal pus discharging lesion. Please give the answer. The investigation or diagnostic procedure you have to tell me.
CT fistulography.
I'm sorry, I can't give it to you. It's an MR fistulography. So that is the investigation of choice because it tells you more about the soft tissues. Okay. So they don't get any marks for this question, but next question they'll get. What is lift procedure in relation to treatment of perianal fistula?
Ligation intermittent fistulas.
Yes. So I give it to her. So it is the ligation of intersphincteric fistula tract sphincter saving procedure done for treatment of fistula. So team A will get 20 marks for this round. Next we go to team B. Okay, see carefully the picture. It is the procedure which is done by anesthetist for surgery of a soft tissue tumor excision on arm. You have to see both the pictures and then tell me the procedure which is being done.
Ma'am, it is performing a ultrasound guided brachial block.
Yes, very correct. Round of applause for her. So this is done by anesthetist and it's a USG guided axillary nerve block, but I'll give it to her. Okay. So next question for team B, they get 20 marks for this question. Next question. In which plane is the local anesthetic drug infiltration done in a TAP block, that is transversus abdominis plane block?
The T12, the
I'm sorry, you have already answered it, and that's the wrong answer. The question already says which plane you are giving it. So it is the plane between the internal oblique and transversus abdominis. That is the place where the nerves are there. So you block those nerves at that place. So next question is, so they get 20 marks for this round. Okay, no marks for the second question. Next question is for team C. Okay, so look carefully. This was sent to the lab in a patient presenting with paroxysmal episodes of headache, palpitations, and sweating. Now you have to tell me what is the likely diagnosis in this patient.
Pheochromocytoma.
Absolutely right. So can you tell me why this 24-hour urine sample was sent? What is being searched there? No, no extra marks for that, but okay, they'll get 20 marks. So answer is pheochromocytoma. Okay. So next question to team C. Name this drug used in name any drug used in preoperative preparation of pheochromocytoma. I have not written that, to control the effects of excess catecholamines in pheochromocytoma. So
Alpha blockers like
yes, absolutely correct. So you have to control the patient on alpha blockers. Any alpha blockers you can name?
prazosin.
Yes, very correct. But only 20 marks for this question also. So 40 marks to team C. Alpha adrenergic blockers, that is phenoxybenzamin, prazosin, that can be given. Okay. Now next question goes to team D. Team D ready? Okay. Identify the investigation done in nuclear medicine department to assess the biliary excretion.
HIDA scan.
Yes, very correct. Absolutely right. 20 marks. It is a hepatobiliary imidodielectric acid scan. Okay, so that is a correct answer. Next question to team D. Name an intraoperative diagnostic procedure during cholecystectomy, maybe lap or open, to exclude stone in CBD.
Intraoperative cholangiography.
Yes, that is right. So that is one option. So definitely I'll give it to them. Intraoperative cholangiography or choledocoscopy also is an option. Okay, so they get 40 marks for this round. Then we go to team E. Ready? Okay. Name the procedure in a patient of intestinal bleeding which is not seen on upper as well as lower GI endoscopy.
Capsule.
Yes, very correct. You can see a capsule being ingested by a patient and it gives the real-time picture. So it is, the answer is correct, absolutely right. They get 20 marks for this question. Next question is for team E again. When do typhoid ulcers characteristically perforate in the timeline of the disease?
Timeline means in the fourth week or
Okay, I'll, yes.
4 to 6 weeks.
So I don't think I can give it to her because she said 4 to 6 weeks.
So,
it is actually third week. So I'll not give it to her. So they get 20 marks for this. Okay. Then next question is to team F. Team F, you have to, this is for you. Name the investigation done in a 70 years old male with bladder outlet obstruction. Team F.
post-ward and pre-ward urinary collection.
No, I'm afraid I can't give it to you. You can see that it is attached to a device. The person is urinating. So these are uroflowmetry or urodynamic studies. Okay, so that is the correct answer. Now, next question still, so they don't get any answer for this. Next question is to team F again. Okay, what is the diagnostic level of PSA in carcinoma prostate?
More than 10 nanogram per ml.
No, I'm sorry. It is anybody from the audience? Nobody? No, wrong answer. I don't get it. I don't hear you.
4.
No wrong answer. Correct. Now I only get the chocolate now. It's more than 35 nanograms per ml. Okay. So that is diagnostic of carcinoma of prostate. So team G gets no marks in this round. Team F, sorry, team F, sorry. Next question is for team G. Are you ready? Yeah. So name this investigation done in a patient with obstructive jaundice without palpable gallbladder. Running. Sorry, the time is up. Audience? Nobody? Pardon? This is a percutaneous transhepatic cholangiography. Okay, for higher lesions. Then next question is for team G again. So they don't get any marks for this. What is Klatskin tumor? No? Okay. So the question passes to audience. So it seems to be a very easy question. So no chocolate to anybody? Or give multiple chocolates. Okay. So I think this brings us
Hilar
to the
cholangiogram.
yes.
Hilar cholangiocarcinoma.
Everybody answered it so loudly I could hear it. Okay. So this brings us to the end of this round. Okay. So the answer is hilar cholangiocarcinoma. Okay. So thank you so much. And I wish all the best to all the students who participated in this quiz. Thank you so much.
Thank you, all the students. I request you to kindly occupy your seat in the audience. We will be starting with the inaugural function in 5 minutes. So please do not leave the hall. Please remain seated. Meanwhile, we make the arrangements and the scores are there. Display off. Please carry your placards. Team A. Okay.
Honorable Chief Guest, Executive Director, Professor Dr. Prashant P. Joshi, sir. Patron and founder of quiz, Professor Dr. Subrajit Das Gupta, sir. Convener and host of today's quiz, Head of Department, General Surgery and Dean Student Welfare, AIMS Nagpur, Professor Dr. Siddharth P. Dubhashi, sir. Guest of honor, ex-professor and head gynecology, GMC Nagpur, Dr. Manorama Porwar, ma'am. Chairperson, Quiz Committee, Dr. Prachi Mahajan, ma'am. President, Association Surgeons of Nagpur, Dr. Deepa Jahagirkar, ma'am. Honorary Secretary, Association Surgeon Nagpur, Dr. Praveen Veragare, sir. Esteemed quiz master, judges, scorekeepers, timekeepers, eminent faculty and surgeons, and students in the audience. Participating teams. I, Dr. Soumya Chopra, Assistant Professor, General Surgery, IMS Nagpur, on behalf of Host Institute, welcomes you all to the 29th late Dr. Indrajit Mitra Memorial Undergraduate Maharashtra State Level Surgery Quiz 2026. Respected sirs, this quiz carries a legacy of Association Surgeons of Nagpur, which is unparalleled with any city chapter in the whole country. All the undergraduate students aspire to and look upon the opportunity to participate in this academic extravaganza. Now, I'd like to invite Professor Dr. Siddharth P. Dubhashi, sir, to please accompany our chief guest, Honorable Executive Director Dr. P.P. Joshi, sir, and Professor Dr. Subrajit Dasgupta, sir, to the dais, please. Now, I would like to request Dr. Prachi Mahajan, ma'am, to please accompany Dr. Manorama Porwar, ma'am, to the dais. Now, I would like to request Dr. Praveen Veragare, sir, to please accompany Dr. Deepa Jahagirkar, ma'am, to the dais. Let us invoke the blessings of Almighty, for which now I would like to request all the esteemed gathering on the dais to please come up for the lamp lighting.
या कुन्तेन्दुतुषारहारधवला या शुभ्रवस्त्रावृता या वीणावक्रदण्डमण्डितकरा या श्वेतपद्मासना या ब्रह्माच्युतशङ्कर प्रभृतिभिः देवैः सदा वन्दिता सा मातु सरस्वती भगवती निःशेषजाड्यापहा शुक्लां ब्रह्मविचारसारपरा आद्यां जगद्व्यापिनीं वीणां पुस्तकधारिणीमभयदाम् जाड्यान्धकारापहा हस्ते स्फाटिकमालिकां विदधतीं पद्मासने संस्थिता वन्दे तां परमेश्वरीं भगवतीं बुद्धिप्रदां शारदाम्
Sir, now I would like to request Dr. Siddharth Pidubhashi sir and Dr. Deepa Jahagir ma'am to kindly felicitate our chief guest today, Dr. Prashant P. Joshi sir. Now, I would like to request Dr. Siddharth Bhashi sir and Dr. Deepa Jahagir ma'am to kindly felicitate Dr. Subrajit Dasgupta sir. Now, I would like to request Dr. Deepa Jahagir ma'am. Now, I would like to request Dr. Deepa Jahagir ma'am and Dr. Praveen Varagade sir to kindly felicitate Dr. Manorama Porwar ma'am. Now, I would like to request Dr. Deepa Jahagir ma'am and Dr. Praveen Varagade sir to kindly felicitate Dr. Siddharth Pidubhashi sir. Now, I would like to request Dr. Praveen Varagade sir to kindly felicitate Dr. Prachi Mahajan ma'am. Now, I would like to request Dr. Praveen Varagade sir to kindly felicitate Dr. Deepa Jahagir ma'am. Now, I would like to request Dr. Divish Saxena sir to kindly felicitate Dr. Praveen Varagade sir. Now, I would like to request our President Association Surgeons Nagpur, Dr. Deepa Jahagir ma'am, to please deliver the welcome address.
Respected dignitaries on the dais and off the dais, Honorable Chief Guest, Dr. Prashant Joshi sir, Executive Director and CEO AIMS Nagpur, Honorable Patron and Founder of Surgical Quiz, Dr. Sukrajit Dasgupta sir, former Dean and Professor Emeritus and ex-director of RST Cancer Institute Nagpur, our guest of honor, Dr. Manorama Purwar Madam, esteemed faculty and former Professor Gynecology, GMC Nagpur, respected Dr. Siddharth Dubashi sir, Professor and Head of Department of Surgery and host and convener of Surgical Quiz, respected judges, Dr. B.S. Gedam sir, Dr. B.B. Gupta sir, Dr. Rajendra Sauji sir, Dr. Dubashi sir, respected Chairman of Quiz Committee, Dr. Prachi Mahajan, EC member of MASI and Quiz Master of ASN, and co-chairman of this quiz committee, Dr. Nirmal Patle, eminent laparoscopic surgeon, director, Aureus Hospital, Nagpur, distinguished faculty members, respected past presidents, senior surgeons, our quiz masters, enthusiastic postgraduate students and residents, interns, undergraduate students, and my dear colleagues. A very good morning to one and all. It's my it's my great privilege and honor as a president of Association of Nagpur to welcome you all on this 29th Dr. Indrajit Mitra Memorial State Level Surgical Quiz being hosted today at AIMS Nagpur. This annual event has become one of the most eagerly awaited academic activities in our surgical journey. For nearly 3 decades, it has inspired generations of surgeons to strengthen their knowledge and sharpen their clinical reasoning and develop a spirit of healthy academic competition. Today, we are proudly continuing that remarkable journey and legacy. We gather today to pay a tribute to late Dr. Indrajit Mitra, an outstanding surgeon, dedicated teacher, visionary whose commitment to humanity and surgical education continues to inspire us. The most meaningful tribute we can offer is to nurture curiosity, encourage excellence, and uphold the highest standards in our profession. I extend my heartfelt gratitude to our chief guest, Dr. Prashant Joshi sir, for graciously accepting our invitation in spite of his busy schedule. Your leadership has transformed AIMS Nagpur into a center of excellence in patient care, medical education, and research. We are deeply honored by your presence, sir. Our sincere appreciation also goes to Dr. Subhajit Das Gupta, sir, whose vision, dedication gave inspiration to this prestigious surgical quiz. Sir, your commitment to academic excellence has benefited countless surgeons across and specifically in Maharashtra and abroad. We are equally privileged to have Dr. Manorama Purwar, Madam, Professor Emeritus, eminent gynecologist, whose distinguished contribution to medical education and patient care has inspired generations of healthcare professionals. We congratulate Dr. Siddharth Dubashi sir and his dedicated team, Dr. Divi Saxena at AIMS Nagpur, for meticulously organizing this event. Their hard work and commitment have ensured that today's program provides an excellent academic platform for all our young doctors, surgeons, upcoming medical graduates. I warmly welcome all the participating teams from various medical colleges across Maharashtra and around. Your enthusiasm, preparation, willingness to learn are the true strength of this event. Remember that while there will be winners today, every participant lives with greater knowledge, richer experience, and lasting friendships. I'm just a namesake. It's a ASN team. So I'm also acknowledging our respected quiz master. Special mention to Dr. Abdul Qureshi sir, Professor and Head of Department of Surgery and Trauma Center, GMC Nagpur, the most accomplished quizmaster since 3 decades, and it's privilege to attend his rounds. Respected judges, faculty members, scorers, time keepers, which are the backbone of this quiz, logistics, which is headed by Dr. Rajiv Sonarkar, Professor and Head of Department of Surgery, Shalintai Mege Institute of Nagpur, Dr. Sargure, he's an associate professor at GMC Bhandara, Dr. Savarkar, professor at AIMS Nagpur, Dr. Tanmay Tapse, the practicing surgeon at Pavni Bhandara, and every individual who has contributed to making this event a success. The Association of Surgeons of Nagpur has always believed that continuous learning is a cornerstone of surgical excellence. As surgical science advances rapidly and new technologies and involving techniques are there, the academic activities such as quiz, this is a backbone and this is an integral part of competence based medical education. It plays a vital role in fostering lifelong learning and evidence based practice, especially in Gen Z generation. I wish all the participants the very best. May today's competition be intellectually stimulating, enjoyable, inspiring, Let us celebrate knowledge, teamwork, and enduring spirit of surgical education. Once again, I extend my warm welcome to each one of you. Thank you for your gracious presence, and I wish 29th in Dr. Indrajit Mitra Memorial State Level Quiz every success. With a happy note, as it is a quiz time. Guess what inspiring song I am expressing. Just guess it out. Can anyone guess? Yes. So sing with me. रुक जाना नहीं तुम कहीं हार के कांटों पे चल के मिलेंगे साए बाहर के. Come on, Didi. ओ राही ओ राही ओ राही ओ राही. Thank you so much. Long live ASN. Jai Hind. Jai Maharashtra. Jai Bharat.
Ma'am, I would like to thank you for the kind welcome address. Now I would like to request our chairperson, quiz committee, Dr. Prachi Mahajan, ma'am, to please address the gathering.
Thank you, Dr. Soumya. Good morning, respected dignitaries, colleagues, friends, boys and girls. Without you, this quiz is not possible because the quiz is for you. I stand here proudly today as chairperson quiz committee for the 29th edition of this flagship event of the Association of Surgeons. So as you can see, the 29th edition. So some people who are sitting here today have been here as participants a few years ago. The quiz has seen generations of surgeons. It was conceptualized by Dr. Dasgupta and carried forward gloriously by every team of ASN thereafter. Dr. Indrajit Mitra Memorial State Level Intercollegiate Quiz has evolved and transformed from simple techniques and technologies, simple methods of presentation and preparation of those times to the phenomenal technological revolution that surgery itself is now witnessing. The first ever quizmaster, Dr. Rajendra Sauchi. We are blessed to have him here today as a judge, and I remember him conducting the quiz with small transparencies and small film slides, which were projected on a projector. Whatever the technological advances may have been, what has remained steadfast over the years is the extremely strong foundation of surgical principles that we all still believe in, and our collective passion towards learning and gaining knowledge of surgery as an art and science. I am grateful to President Dr. Deepa Jahagirdaar and joined by an Honorary Secretary Dr. Praveen Vairagade for their untiring efforts. I sincerely welcome Purvar Madam, our esteemed guest of honor, a contemporary of Dr. Indrajit Mitra. We are blessed to have Director and CEO of AIMS Nagpur, Dr. P.P. Joshi, with us here today. And he and Dr. Dubhashi have generously given us this grand venue for this grand event. Dr. Dubhashi, as convener and judge, he is convener of the Quiz Committee 2026. He has been the guiding light, the perfectionist, owner friend for us throughout the preparation of this quiz. The quiz masters have already been introduced, but I will just highlight a few qualities, salient features of each of them from the point of view of the quiz. Dr. Abdul Qureshi has been the wordsmith. Dr. Mrinalini Borkar, the perfect teacher, hardcore teacher, hardachi teacher. The pivot who has been carrying this mega event gracefully on his shoulder since many years, Dr. Divish Saxena. The most focused, Dr. Soumya Bhushao. The man with brain and brawn, Dr. Nirmal Patil. The wise gentleman, Dr. Nitin Sherkar. The man always on the move, Dr. Rajvilas Narkhede. the enthusiastic academician, Dr. Vandana Tome. And then there's me, one of the quiz masters after a long time. We have an eminent panel of distinguished judges, score managers, timekeepers who have already been introduced and they will be felicitated in the vote of thanks. With this introduction, I congratulate the 7 teams who have qualified for the finals and also congratulate all the participating teams who have come from all over Maharashtra and outside. Winning and losing are two sides of the same coin, and we are all students for life. So, dear participating students and those sitting in the audience, sit back and absorb everything that you can soak up in this learning process. For as we make the quiz each year, we also learn a lot many things newly every year. On behalf of the Association of Surgeons Nagpur, I welcome you all to the brain-racking, exciting second part of the 29th Dr. Indrajit Mitra Memorial Quiz. Thank you so much.
Thank you, ma'am, for the kind introduction of the quiz committee and the quiz. Now I'd like to request convener and host of today's quiz, Head of Department Strategy and Dean Student Welfare, Professor Dr. Siddharthi Devashi, sir, to please address.
Our dynamic visionary leader of AIMS Nagpur, our respected Executive Director and CEO, Professor Dr. Prashant P. Joshi, sir, the patron for the event, the man who conceived this idea of having this particular quiz, Professor Subrajit Dasgupta, a mentor for all of us, esteemed guest of honor, Madam Purwar, the chairman of the quiz committee, Madam Prachi Mahajan, the president of ASN, Madam Deepa Jagirdar, the secretary, Dr. Praveen Varagade, the esteemed panel of judges, the past presidents of the Association of Surgeons of Nagpur, members of ASN attending the event, my esteemed colleagues from the Department of Surgery here, all dear postgraduates, interns, and dearest of all undergraduate students here at AIMS Nagpur, and the participants. It's indeed a pleasure to have this flagship program of ASN, that is the late Dr. Indrajit Mitra Memorial Surgical Quiz, being held here again for the second time here in this crawling campus of AIMS Nagpur. And I must thank the ASN Executive Committee for allowing us to host this wonderful program here. We have got excellent participation, over 18 teams from all over the state, one from the state of Madhya Pradesh as well. And we have already gone through the qualifying rounds. Heartfelt appreciation to all the quiz masters, the scorekeepers, timekeepers, all of them. The entire team is such a vibrant team to have this flagship program being displayed here so effectively. We all concentrate on various innovative teaching learning pedagogies. But here we have a man, Professor Subrajit Dasgupta, who thought of this particular innovative teaching learning tool, a very powerful teaching learning tool, and that is having a quiz for the undergraduate students. All of us most of the time focus on postgraduate surgical education, but then he thought of this 29 years ago when there was not much discussion on the student-centric pedagogies. And it has come a long way. And every year we see a very vibrant version of the quiz competition. So once again, we're extremely happy to have you all here. We have already gone through the qualifying rounds and much more to come, much more to learn. Sit back and enjoy the academic extravaganza. Thank you one and all. God bless. Jai Bharat.
I would like to thank you for the heartfelt message and the importance of pedagogy. Now I'd like to request guest of honor, ex-professor and head Department of Gynecology, GMC Nagpur, Dr. Manoma Purwar ma'am, to please share some nostalgic thoughts.
Dear colleagues, friends, young boys and girls. Good morning. Indeed, it is a great honor for me to be here at premium institution, synonymous with academic excellence, commitment to medical education, and patient care. Because I never had an opportunity to work in the AIMS. If I could have been younger than this, so I could have worked at the AIMS. Today we are remembering an extraordinary person, my classmate and my batchmate too, Dr. Indrajit Mitra. His roll number was 2 and mine was 24. So throughout our undergraduate education, we were in the same batch. So I had a great opportunity to have an interaction with him many times during our UG career. Dr. Mitra was a studious, sincere, and very, very intelligent student. He had gold medal in almost all subjects. Today, we had a prestigious state level surgical quiz in his remembrance. And why we are arranging this quiz? Because quiz is a platform which celebrates not only the knowledge, but teamwork and ability to respond under pressure. Looking at the young participants, I must say that we are witnessing a future generation of medical profession, that is Gen Z doctors. You are the first generation to grow up with the entire knowledge literally at your fingertips. You can access surgical videos, research paper, clinical guidelines in seconds. You all are comfortable with technology, artificial intelligence, simulation, digital learning, of which our generation had never imagined or thought of. But here, I would like to urge you all, never outsource your clinical judgment and empathy to technology. At the end, I would like to say that arranging a state level quiz is a mammoth task, and I appreciate Dr. Deepa and her team for arranging this state level quiz which unravel the knowledge, promptness, and teamwork. Here, I would like to thank organizers for inviting me for this prestigious function. Here, I would like to say for the last round, all the best and let the best team win. Jai Hind, Jai Bharat.
Thank you, ma'am, for this thoughtful message. Now, I would like to request patron and founder of Quiz, ex-dean NKP Salve, and ex-director Rashtriya Santapuroji, or Cancer Hospital, Dr. Subrajit Dasgupta, sir. Please say a few words.
My friend, colleague, and CEO and chairman of this prestigious institute, Prashant. Purvar madam, my teacher of all of us seated here. The organizing committee of this quiz contest, my teachers, colleagues, temporaries, and my dear students. I have been given 2 minutes by the president to speak. And fortunately, I was not introduced saying words of wisdom, which every year I have been attempting to give. So, my dear students, no words of wisdom. You are all very excellent academicians, one of the meritorious students of this country, I should say. looking at the ranking of AIMS Nagpur, recently released by Government of India. And as a Nagpurian and as a student of the alma mater GMC, it's indeed a very proud moment to have an institute which is in the top 20 of the 823 odd medical colleges in the country. This quiz contest was started by me in memory of Dr. Indrajit Mitra, who was my brother-in-law. He carries a big distinction, being a academician of high order, both at his undergraduate and postgraduate days, and still holds the record of winning the maximum number of gold medals under the then Nagpur University, which is still not broken in the last 50 years. Apart from this, he as a human being, as a surgeon, has been a person of high order, and his demise at an earlier age abruptly ended a career which was par excellence. And I, walking in his footsteps, trying to fit my feet in his shoes, started this quiz in his memory in order to continue the legacy which he had once started. We are all mortals. Today we are here, tomorrow we may not be here, we will not be here. That's the rule of the world, which one has to accept. But the memory and the legacy goes on. In our field of medicine, irrespective of the specialties, it hardly matters how many patients we have seen, how many operations we have done, what great achievements you have in your professional career, how high you have climbed the stairs in administration and in other hierarchy. What it matters is the impact which you have made, the indelible impression, how many minds you have motivated, and the impressions which you have left behind, your footprints in the sands of time, so that people remember you when you are not there. That is the importance of what is called as legacy, and that is what exactly I have tried to do. Generations over, there has been excellent people. I'm sure many of you seated here today would achieve that goal in your lifetime. That you will do, all of you. One thing which is an integral part of your shaping up as a good human being is your empathy and the sympathy and the holistic approach to a patient, and to relieve that patient physically and mentally of the agony he is suffering from. I am sure you all are bright students, and this quiz contest has been more lively because I am sure you all, your preparations and these MCQs you go through every day, and the standard of this quiz contest have been rising year after year, and there has been a higher benchmark. And therefore, I do not know what will be their level in future, but I am sure that with highly talented group of the quiz masters which we have, right from Dr. Rajendra Saoji and Abdul Qureshi and a host of others. There were in last 29 years, 29 past presidents and 29 chairpersons of this committee and a long list of quiz masters who have continued to bear this torch of excellence year after year. And I'm sure they will continue to do so. This is the second time I'm coming in this grand auditorium. The last time was when this quiz contest was held about a couple of years back. I'm extremely happy to see you all, meet you. I would have been happier had all these seats been full because this particular program is for you. Anyhow, I wish you all the best. I congratulate all the teams who have participated and may the best team win. Thank you.
Thank you, sir, for the wonderful message. Every year, the topper of surgery at GMC Nagpur is awarded late Dr. Indrajit Mitra Silver Medal. I would now like to request Honorable Executive Director, sir, to please award Miss Sayali Talwade this auspicious medal. Miss Sayali Talwade. Now, I would like to request our chief guest, Honorable Executive Director, sir, to kindly address the gathering.
Good morning, everyone. It's not afternoon. Good morning, everyone. Respected dignitaries on the dais, my teacher, Dr. Panorama Purwar, as he probably is the teacher of all of us sitting here. Dr. Subrajit Das Gupta, 1 year my senior and a close friend. And Dr. Prachi Mahajan, who is in charge of the chairperson of this quiz committee. Then Dr. Zagirdar, who is the president of ASN. Dr. Veragade, secretary of ASN. And Dr. Rubashi, who is the professor and head of medicine at professor and head of surgery here at AIIMS, and not only professor and head of surgery, but also he's doing a wonderful job as dean student welfare, and he probably knows the names of all the undergraduate, postgraduate students. Not only knows the names, he knows their family background. He knows their names of their brothers and sisters also. So you all agree with that, huh? That's a typical Gen Z response. But you all agree with what I said? I think people who know Dr. Dubashi would agree with that. There are a lot of dignitaries of the dais also. Dr. Raju Sauji, who is I remember him conducting, he and Abdul Qureshi conducting quiz for Academy of Medical Sciences for undergraduates. There are other senior faculty, senior surgeons sitting here. Dr. Gedam is here, who is one of the senior most surgeons, and a lot of other. Dr. Brajesh Gupta, professor of surgery. Dr. Prashant Rate, and I can see the whole of Department of Surgery sitting here in the audience, and all my undergraduate students here. It's a great pleasure to welcome you to AIIMS Nagpur. You must have seen the campus. It has a beautiful. We have a beautiful campus, nice ambience, and it's a great pleasure to welcome all of you here at AIIMS Nagpur. Quiz, in fact, is a very important and a very innovative way of learning. I'm sure you must have, all the undergraduates must have, who are participating, must have done a lot of preparations. to come here and participate in this quiz. It's a very interesting way of learning. One of the we all know that didactic lectures is one of the worst forms of teaching learning methods, and it is these various forms of teaching learning methods of these quiz is one of the most interesting. And you all of you must be watching Kaun Banega Crorepati. It's very interesting to see how the quiz master, the great Amitabh Bachchan conducts it. So it's very interesting to participate in the quiz. Everything is under a lot of tension and then all fun. Things which you learn in quiz, in fact, maybe somewhat rare, but then would definitely form an indelible impression in your mind. And you would probably remember everything here because there are various formats. One of them would be quiz. I'm sure there must be some clinical question, scenario type of questions, some photographs, and some historical events on the quiz also. I'm sure that kind of varied questions must have been prepared by the quiz committee. And it's great to see 18 colleges, undergraduate students coming here and participating, and 17 from Maharashtra. That's great. It's a great pleasure and pride to welcome all of you here for this important event. And all the other speakers have already spoken about the great Indrajit Mitra. And he has, and this would be the 29th edition. It's wonderful to see that this undergraduate quiz is going on successfully, being conducted since last 29 years. And the force behind it is Dr. Suprajit Dasgupta and all the, of course, the whole surgical departments and all the surgeons who are responsible for continuing it. Otherwise, what happens? You start an event and then subsequently, after a few years, the people lose interest. But for maintaining that type of tempo for 29 years is really very creditable, and I congratulate all the surgeons, the Association of Surgeons of Nagpur, and Subrajit Dasgupta for maintaining that tempo and continuing with this event since 29 years. It's a great effort. So we at AIMS, in fact, are committed to provide quality education of various types. We will always encourage all sorts of programs of and different forms of teaching, learning, conferences, quizzes, the workshops and seminars. And one of the aims is that we produce not only medical graduates, but also we want to produce medical leaders of the future. The kind of ecosystem which fosters future medical leaders is what we try to achieve here, not only in education, but also we provide an ecosystem to provide uh, people and encourage people to do innovative and path-making research and provide evidence. And here we are only 7 years old, and still you can see the number of patients and workload which has increased exponentially here in AIMS Nagpur. And because we are committed to provide accessible and affordable evidence-based tertiary care to the poorest of the poor. And we all know that majority of our patients here are being either treated free in the BPL scheme or under the various government schemes. And you all know the cost of critical care and tertiary care in private setup, where majority of poor people cannot reach. And here that AIMS Nagpur comes in to provide the world-class tertiary care and critical care to the poor people who cannot afford this type of treatment. Thank you very much for Dr. Dubashe and the Association of Surgeons for having organized and chosen AIMS as one of the venue for this quiz. And I wish all the participants all the best. And as has been said, it is not a question of winning and losing. It's a question of participation. Enjoy the participation and enjoy the quiz and learn a lot of things, new things from your seniors here. And I'm sure it would be a productive academic feast for you to take back certain memories from here. Thank you very much. Jai Hind, Jai Maharashtra.
So I would like to thank you for the pearls of wisdom you shared with the gathering. Now I would like to invite Honorary Secretary, Association Surgeon Nagpur, Dr. Praveen Varagade sir, to please deliver both of things.
Thank you, Dr. Soumya. On behalf of Association of Surgeons Nagpur, I thank respected Chief Guest Dr. Prashant Joshi sir, Executive Director AIMS, for gracing the occasion. My sincere thanks to our patron and founder of the late Dr. Indrajit Mitra Surgical Quiz, Dr. Subrajit Dasgupta sir, for his vision that keeps the quiz alive years after years. My thanks to the guest of honor, Dr. Purvar Madam, to grace the occasion and enlightening us. Special thanks to Dr. Siddharth Dubashi sir for his keen interest in the academic event and accepting our request to do the quiz at AIMS and his guidance at every step. Thanks to our President ASN Dr. Deepa Jagidar Madam for accurate planning. Thanks to the Chairman Quiz Committee Dr. Prachi Mahajan, Co-Chairman Dr. Nirmal Patle for taking great efforts for the success of the quiz. Thanks to all judges, our gurus, Dr. Gedam sir, Dr. B.B. Gupta sir, Dr. Siddharth Dubashi sir, Dr. Rajendra Saoji sir for accepting this role of judges. I would like to thank scorers and timekeeper Dr. Raju Sonarkar sir, Dr. Tanmay Tapase sir, Dheeraj Shangrure sir, and Dr. Savarkar sir for taking this responsibility. Hats off to the hard work and dedication to our quiz master, Dr. Abdul Qureshi sir, Dr. Prachi Mahajan madam, Dr. Mrunali Borkar, Dr. Devi Saxena, Dr. Nirmal Patle, Dr. Vandana Tome, Dr. Nitin Sherekar, Dr. Rajvilas Narkhade, and Dr. Soumya Ghoshal. Thank you very much. I thank the participating colleges and the respective head of department and the dean for sending their team for this prestigious quiz. I thank UCN Cable, Press and Media for and the dignitaries for covering this session. I thank the dignitaries of the dais, our past president, Dr. Deshpande, Dr. Rahate sir, Dr. Wilkinson sir, Dr. Shenoy sir, Dr. Gupta sir. Lastly, I thank MOC, Dr. Soumya Chopra, for smooth and time-bound conduct of the program. Now I request our chief guest, Dr. Prashant Joshi sir, to felicitate him with a token of love. Dr. Soumya. Thank you all for being here for this prestigious event at this prestigious and beautiful venue of AIMS. Jai Hind.
Now I would like all to kindly stand up for the national anthem.
We will be announcing the results very soon. And then we will have a draw of lots for the top 7 teams for their positions on the dais. And then we will start with the final rounds. We can have a short 5 minutes break. You can go and you can have tea and snacks, which is being served in the lobby. All the students, they can go. Students, audience can have a small break of 5 minutes and then reassemble because we are shortly announcing the results. And you have to witness who are the 7 teams who are going to be there to play the finals. इसको बताते हैं वो एक ही बदल रहा होगा बदल रहा होगा तो I request all the students who are there in the gallery to please occupy their seats in the auditorium. We are going to announce the results, and I think it will be announced in the descending manner, ascending manner, ascending manner. So out of 19 teams, 7 teams will be playing the final rounds, depending upon what marks they have scored in their qualifying rounds. So once we come to know who are the 7 teams that are going to play, there will be again draw of lots for your position on the dais about the team you are going to play. Dr. Nirmal and Dr. Rajvilas, they are looking into the scores and they are increasing the anxiety, the palpitation, the nervousness. So we are ready with the scores. Can we have the display, please? This Nirmal, you can control from there. So these are the results of round 1, qualifying round 1. Can see GMC Yavatmal with 110 points, PDMC Amravati with 135, GMC Akola with 130, KM Mumbai with 140, IGMC Nagpur with 140. AIMS Nagpur has scored
Total 200 out of 200. Great percentage. So these are the results of qualifying round 1, qualifying round 2, round 2. Yeah, so these are the results of round 2. GMC Nagpur with 130, GMC Gondia with 110, GMC Sambhaji Nagar with 180, JNMC Savangi with 170, MJIMS Sevagram with 170, and NKP Nagpur from 175. So round 3, UPMC Jalgaon with 145, DMMC Nagpur with 115, GMC Vidisha with 175, BJMC Pune 135, GMC Chandrapur 100, GMC Nanded 105, and GMC Bhandara 120. So now we are showing the result in ascending order. So great round of applause for GMC Chandrapur 100 marks, GMC Nanded 105, GMC Godia 110, VNGMC Yavatmal 110, DMMC Nagpur 115, GMC Bhandara 120, GMC Nagpur 130, GMC Akola 130, BJMC Pune 135, PDMC Amravati 135, IGMC Nagpur 140, and KEM Mumbai 140. So now the final 7 teams who are going to play. So team 7, 7th position is UPMC Jalgaon, 145 marks. A great round of applause. On rank 6 is JNMC Savangi with 170 marks. MGIMS Sevagram 170. NKP Nagpur 175. GMC Vidisha 175. GMC Sambhaji Nagar with 180. And rank 1 AIMS Nagpur with 200. So thank you all the participants. It's a fair result, and these top 7 teams have qualified for the finals, but there is a lot to learn from the final rounds also. So please stay, do not leave the auditorium. There are not many now audience prizes to be won. So I now call one by one teams to pick their chit and occupy their position on the dais, starting from rank 1 AIMS Nagpur. So any one of you can come here, pick up this chit. And please occupy your position, bring your placard and occupy your position on the dais. So they will be playing as Team C. AIMS Nagpur. Team C.
AIMS Nagpur, Team C.
GMC Sambhaji Nagar.
Wait. Just this Ullas Patel Medical College. Team.
So we are calling.
No. So you are from which college? No, you'll have to wait. You'll have to wait. You're not supposed to pick up the quiz. We want GMC Sambhaji Nagar to come here. Hey, AIMS Nagpur. Sambhaji Nagar. Team GMC Sambhaji Nagar will be Team B.
Team B.
B.
Please
Next,
bring your
GMC
placard and occupy
Vidisha.
your position on the dais. AIMS Nagpur also, please occupy your position on the
Yeah, you
dais.
occupy with your placards. You occupy your teams, your positions on the dais. Team Vidisha. Team GMC Vidisha is Team E. NKP Salve Medical College, Nagpur. Team D, NKP Salve Medical College, Team D. MJMIS Sivagram. Sevagram will be team F. JNMC Savangi. Who is from JNMC? Team G. JNMC is Team G. And this Ullas Patel Medical College, Jalgaon. Yes, team from Jalgaon will be Team A. Thank you.
So congratulations to all the winners. And we welcome you to play qualifying rounds. As you have seen already in the quiz map, there will be 7 rounds that will be played here. And then final 3 winners will get the prize, right? So again, audience, please do not shout. The question will be directed to you. There are specific question for audience also, so you will get your chance to answer. So we will be starting with the rounds. I think you please check your mic and buzzer. Starting with team A. Team A, please check your mic and buzzer.
Hello.
Mic is working, buzzer is not working. Okay, it's working now. Team B,
Hello, hello.
please check your buzzer. Right. Team C.
Hello.
Okay. Team D.
Hello.
Yeah. Team E.
Hello.
Team F.
Hello.
Team G.
Hello.
Okay. So your buzzer, mic, everything is working. So we will be starting with the very first round. Can we have the display, please, from this computer? Right. So we will be starting with this round. So I'll tell you about the round. So this is the round named as Hunt the Hints or Allusion round. So allusion, as you know, you can see in this picture is a statue of Achilles, and his mother, when he was a baby, she holded her with the ankles, near the ankles, and dipped it in river Styx so that his body will become strong. But then the part which she was holding was weak, and that was the weak link. Though he was very strong, but then Apollo's arrow shot into his heel, and that's why that was a weakness in his strength. So it was a reference which we give as weakness in somebody's as Achilles heel. So that kind of questions you are going to have here, right? So just go through the rules. So this is a clockwise round. So I will be starting with team A. A grid containing the allusions with options A, B, C will appear on the screen. Each team will have the option of selecting any available allusion and choice of available options from the grid. Each option will have question 1 that will denote a allusion or reference to a surgical condition, sign, etc. And question 2 will be a related question to that question 1. Once the question is once the option is selected, the team cannot change the option. The team will get 15 seconds to answer each question. There will be 20 marks each. In case of partially correct answer, because some questions may contain 2 components, so I will give the marks accordingly. There will be no negative marking. This round is not a passable round, and for your convenience, we are going to play this round twice. Okay, so once I reach from A to G, we will again start from A to G, right? So this round will be played twice. So you are having 80 marks at stake, right? So observe carefully and play. So to get the feel of how the round is going, we are having this question for the audience. So audience, you can select between automobile and fast food. Okay, so you have selected fast food. Okay, but I am going to ask both the question. So here is the question for the audience. You will get the nick of how the questions are going to be asked. So this will be your hint, right? And this will be the question. What is shown in the above video and picture? Audience. Anyone can raise the hand and answer.
Donut sign for piles.
No, no, no. It is not for piles. Yeah. So it is adequate thickness anastomosis. So I think Dasgupta sir himself has answered it correctly. So it is a complete donut of bowel and adequate thickness anastomosis. So I'll ask another question to the audience, though, because you have not answered it. So this is automobile. So this is your illusion. And this is the question. So this is a CCT of abdomen of an obese 40-year female patient with dull aching pain and right hypochondria. What is the diagnosis and sign?
Gallstone.
Gallstone is the diagnosis, and what is the sign?
Mercedes Benz.
Very right. So this is how the round is going to be there, right? So now let us come to the main round. So I am starting with team A. So these are your options: hardware, goods, gift, animal, armor, reptile, cartoon. You can choose any category and any option which is available. So set them on mic. Fruits. Which option?
Means fruits.
A, B, or C?
Uh,
There are three options available.
Option A.
Option A. So they have selected fruits, option A. So here is your question. So this is the illusion, and this 1-year-old child presents with a skin lesion at scalp. Spot the diagnosis. Your time has started. 15 seconds.
Aneurysm.
Oh no, you are absolutely wrong. We have already given you the hint. Anyone from the audience? So this is strawberry hemangioma. Very right. Okay, so again I will ask you the second question. So no marks for this question. What is the recommended treatment for asymptomatic strawberry hemangioma? Team A. Your time, 2 seconds last.
Observation and keeping under control.
Observation is absolutely right. So masterly inactivity. So they will get 20 marks. Only 20, right? So now I will move on to team B. You can choose your category and option.
Sir, cartoons and A category.
Cartoons, which A, B, or C?
A.
Cartoons A. So they have selected cartoons A. So let us see what is the question. So this is your illusion, and this is the question. A patient of left above knee amputation pain comes with complaints of sharp stabbing, tingling pain in the missing leg. What is this phenomena called as?
Phantom limb syndrome.
Absolutely right. So phantom limb syndrome. Very good. So now they will get 20 marks. And now second question to you. During amputation, at what level the nerve is to be cut?
About the level of amputation.
Above the level. So they are right. So it has to be pulled and then cut above the level of the amputation. So they are absolutely right. So as not to form any neuroma. So full 40 marks to them. Right. So now we move on to team C. Your category and option.
Hardware.
A. Hardware A. Okay. So here is your illusion. What is the diagnosis seen in this image of neck angiography, and name the sign?
This is liar sign seen in carotid body tumor.
Absolutely right. So they get full 20 marks for this. Second question again will be directed to you. Mobility of this tumor is seen side to side, but not in craniocaudal direction. This sign is called as? So last 2 seconds. Okay. So pass. Anybody from the audience? So this is called as a Fontaine sign, right? So absolutely right. Please give a chocolate to the person. So now we will move on to team D. Please choose your category and option.
Cartoons.
Cartoons, which one? B. B. So they have chosen cartoon B. Right. So here is your allusion. And here is the question. Patient presented with midline and upper lateral form to heart swelling with cytology showing characteristic cells. Identify this pathognomic cell and condition causing it.
Orphan annii nucleus.
Very good. And the condition?
Papillary thyroid carcinoma.
Very good. Absolutely right. So they get full 20 marks. So next question will be again directed to you. Microcysts becoming concentrically laminated calcium containing spherical bodies seen in papillary carcinoma thyroid and sometimes in meningioma serous adenoma of ovaries are called as
Samoma bodies.
Samoma bodies is absolutely right. So they get full 40 out of 40. So now we move on to team E. E. Yes, your category and option.
Fruits B.
Fruits B. So they have chosen fruits B category. Right. So here is your allusion. So this is the allusion. The question. Watermelon stomach on endoscopic view is seen classically in which condition? Please, audience, please keep seconds.
Unifoils region.
No, this is wrong answer. Anybody from the audience? Yes. So many hands.
Gastric antral vascular ectasia.
Very good. So this is GAVE, gastric antral vascular ectasia. So what typical watermelon stomach is seen? So now the second question again to team E. Which simple maneuver during routine endoscopy is used to visualize the fundus and gastroesophageal junction?
J maneuver.
J maneuver is absolutely right. So they will get 20 marks. So now we move on to team F.
Reptiles B.
Reptiles B. Okay. So here is your question. So this is the allusion and this is your question. Identify the anomaly, yellow circle in this intravenous speleogram and name the sign as depicted by allusion.
This is cobra adder head sign seen in uretrocele.
Absolutely right. So this is bilateral uretrocele and you can see typical adder head or cobra head appearance. So they will get full 20 marks. Now the second question is again, for obtaining an ascending urethrogram, the radio-opaque dye should be injected through
Bladder.
No, absolutely wrong. So it is through urethral. It is not to be injected through the urethrogram. Okay. So per urethral. So they will get only 20 marks. Right. So now we move on to team G.
So fruits C.
Fruits C. So they have opted for fruits C. So here is your question. So this is your allusion and this is your question. What is the radiological sign called and name the condition causing it?
Apple core deformity in colorectal cancer.
Very good. So this is apple core sign seen in carcinoma colon. Very good. Brilliant. Avascular, second question again to you. The avascular plane or line through which the ascending colon is mobilized from lateral to medial side is known as team G.
Cockers limb.
No. Anyone from the audience? Yes. Line. You have to name the line. Line of told is the correct answer. So it is white line of told. Correct. So now we have finished with team G. Again, we can start with team A. So you are having lots of options still left. Category and option.
Animals.
Animals.
Animals C.
Animals C. So they have opted for animal C. So this is your allusion.
Ranula.
Ranula is absolutely right. It is also called as frog belly. Very good. So here is your second question. A punching ranula travels through which anatomical structure to manifest in the cervical region? Team A.
Sublingual glands.
Sublingual gland? No. Wrong. So it is through mylohyoid muscle. Okay, so they will get only 20 marks, right? So now we move on to team B. Your choice of category and option.
Cartoons and C.
Cartoon C. Okay. So here is your allusion, right? And here is your question. Identify the pathology associated with underlying psychiatric disorders of trichotillomania and trichophagia presenting with intestinal obstruction.
Sir, trichobezoar.
Oh, I want a complete answer.
Sir, Rapunzel
Rapunzel syndrome is right. Okay, so we will grant them to it. It is a trichobezoar, but then it is extending into the small bowel. So typical Rapunzel syndrome. So 20 marks to them. Yes. So here is your second question. Solid undigested mass composed of indigestible plant fibers, seed or peels in stomach is called as
Phytobezoar.
phytobezoar is absolutely right. So relatively easy set they have chosen. So they get full 40 marks. Now to team C.
And animals A.
Animals A. Okay. So here is your allusion. And here is your question. In this plain X-ray KUB, identify the pathology.
Stroid stone staghorn calculus.
Very good. So it is complete staghorn calculus. So 20 marks. So next question again to you. Usually, what type of calculi develops in patients with presence of infection in alkaline urine?
Triple phosphate stones.
Very good. So triple phosphate or stroid stones they develop in the this thing. So full 40 marks to them. So now we move on to team D.
Animals B.
Animals B. Okay, all of them are fond of animals. Okay, so here is your question. So this is your allusion. What radiological sign is depicted here in a 60-year-old emaciated patient and name the condition causing this sign?
Rat tail sign.
Yeah, and the condition?
Esophageal malignancy.
Very good. So it is carcinoma esophagus and rat tail appearance, typical rat tail appearance you can see. So 20 marks to them. Now the second question is again to team D. What do you understand by the term pseudoachalasia? Last 1 second. Okay, your time is up. Anybody from the audience? Yeah, they have answered now. Malignancy. Very good. So it is malignancy at the lower end. So it is also called as pseudoachalasia. Okay. So they will get only 20 marks. We move on to team E. Your choice of set?
Reptile C.
Reptile C. So they have chosen reptile C. So here is your allusion. And this is the question. Identify the anomaly, yellow circle in this picture.
Moynihan's hump.
Moynihan hump is absolutely right. It is also called as caterpillar term, abnormal right hepatic artery. Okay, so they will get 20 marks. What do you understand by the term floating gallbladder?
Cholecystitis.
No, no. So they are wrong. Anyone from the audience? So it is a gallbladder having mesentery, which is prone for torsion. So they will get only 20 marks. So now we will move to team F.
Reptiles A.
Reptiles A. Okay, so here is your set. This is your allusion, and this is the question. Identify this lesion in oral cavity caused by a sexually transmitted disease.
It is a chronic syphilitic lesion in the oral cavity, precursor lesion for oral cancer.
Absolutely right. So it is syphilitic lesion, snail track ulcer. Very good. So full 20 marks to them. And second question. Name the pathology of this child having a peg-like teeth who is suffering from congenital syphilis. You have to name the pathology or sign.
Hutchinson sign.
Hutchinson sign is absolutely right. Or Hutchinson teeth, right. So they will get full 40 marks. So last team, team G. I have asked with team F now. Team G. Yeah, your choice.
Arms B. Arms and armors.
Arms and armors B. Okay, so you have chosen B. Okay, so here is your allusion, right? And here is the question. What the diagnosis of this patient suffering from a non-inflammatory condition and what is the sign known as? Okay, the time is up. Anybody from the audience?
Carcinoma and cuirassive.
Carcinoma and cuirass. So this is carcinoma and cuirass seen in carcinoma breast. Right. So they will not get any points. So here is the second question. Which one of these muscles denotes fixity to chest wall? Pectoralis major, minor, or serratus anterior?
Pectoralis major.
No, absolutely wrong. Anybody from the audience?
Serratus anterior.
Serratus anterior. You can remove pectoralis major, minor in mastectomy, right? So serratus anterior is the right answer. So they will not get any marks. So thank you everyone for playing this round. I call upon Dr. Nitin Sherkar for his round on connecting the dots.
Okay, so very good afternoon. So before I start my round, I must say what a fantastic audience. Yes. So that suggests the popularity of this ASN surgery quiz. And let's have a huge round of applause for all of you. Great, great. So keep the energy like this only. Okay. So in day-to-day practice, this in the OPD or in the wards or even in the operation theaters, the surgeons are presented with the pieces of puzzles rather than a diagnosis. And every surgeon knows that the diagnosis is rarely made from a single clinical clue. And the art of surgery, it lies in connecting these seemingly unrelated dots to come to a particular diagnosis. Okay, so ladies and gentlemen, welcome to the round connecting the dots, one of the most clinically relevant round of this quiz that tests not only your clinical reasoning but also your memory. Okay, so let's see what are the rules of this round. So this will be an anti-clockwise round. We will start from team G. Then each team has to select a set from a grid displayed on the screen. Each set will have question 1 that contains the 3 clues on which the diagnosis has to be made and which will be awarded 20 marks. So just remember here, some of the questions may contain the components of the triad, but the correct answer will be the name of the disease and not the name of the triad. Okay, you can say the name of the triad, but the correct answer will be the name of the disease in which that particular triad is observed. Okay. Then a second related question again will be asked for 20 marks. So you have a chance to score total 40 marks. Then time to answer each question will be 15 seconds and time will start after completing the question. Then unanswered or wrongly answered question 1 or question 2 will not pass to the next team. There will be no negative marking and judges and the quiz master's decision will be taken. Okay, so any doubt? No? Okay. So let's start with the audience question. So this 6-year-old woman present with the jaundice, upper quadrant pain, and the fever. So what is your diagnosis? Yes?
Acute cholangitis, Charcot triad.
Yes. So the correct answer is the ascending cholangitis. So this is the classical Charcot triad, but the correct answer in this case is the acute ascending cholangitis and not the Charcot triad. Okay. So the second related question, the most common bacteria linked with the ascending cholangitis is audience.
E. coli.
Yes, that's the right answer. So E. coli is the most common, then followed by Klebsiella and Enterobacter. Okay. So now these are the different sets. So just remember, I have given the different names of the flower to the different sets, but there is no relation of the name of the flower with the underlying question. Okay. So you have to just select the set. Okay. So we will start from team G. So before that, think fast, think like a surgeon, and most importantly, connect the dots. Okay. So select your set, team G. Select
Sir,
your
set
favorite
6.
flower.
Set 6, sir. Lavender.
Lavender. Okay, so this is a beautiful flower. The oil, the peculiarity is the oil of this lavender is used for the aromatherapy and for preparing the perfumes. Okay, so here is your first question. So this 42-year-old gentleman present with the colic abdominal pain, vomiting, distension, and obstipation. Then he is a operated case of Roux-en-Y retrocolic gastrogenostomy and a CT suggestive of cluster of small bowel loops in the lesser sac. So what is your diagnosis? Time.
Bowel obstruction due to adhesions.
No, that's the wrong answer. Anyone from the audience? Yes.
Peterson hernia.
Yes, that's the right answer. That is basically the internal hernia. It may be Peterson or the Stammers. So what is the difference between this Peterson and Stammers hernia? Okay, so this Peterson hernia, the loops are present in between the small bowel and the mesocolon. And in the Stammers, it may be anticolic or retrocolic. Okay. Okay. So second question to team G. The underlying embryological abnormality in the paraduodenal hernia is primarily related to
Intestinal malrotation.
mm, it is partially right. It is basically an abnormal fixation of the small bowel mesentery. It is partially right. So can we give it, judges? Yes, yes sir. So 20 marks to team G. Okay. So now team F, please select your favorite flower.
Set to sunflower.
Sunflower. So this flower typically shows the heliotropism, that is turning towards the sun for the better photosynthesis. Okay. So this is your first question. A 40-year-old gentleman present with the cough, expectoration, fever, chest pain, hemoptysis, then a meniscus or a crescent sign on radiograph, and water lily sign on CT scan. So what is your diagnosis?
Hydrated cyst.
Be specific. Site.
Hydrated cyst of lungs.
Yes, that's the correct answer. So it is the pulmonary hydrated disease. So 20 marks. The second question, which part of the lung is most commonly involved in the pulmonary hydrated disease?
Middle lobe of the lung is most commonly involved.
Which? Right, left?
Left middle lobe.
Sorry, that's the wrong answer. Correct answer is the right lung and the lower lobe. Okay. So, so only 20 marks to team F. Okay. So team E, select your favorite flower.
Tulip.
Tulip. Okay. So this is the different beautiful flower that is. I remember just the tulip garden in the Kashmir. That is very beautiful. Okay. So here is your first question. A 60-year-old gentleman present with the abdominal pain, diarrhea, and weight loss. Then right-sided heart walls are more commonly affected, and this produces the number of vasoactive peptides like a serotonin. So what is your diagnosis? I think this question is very simple. These are the classical clues. So time's up. Anyone from audience?
Carcinoid syndrome.
Yes, that's the right answer. Carcinoid or the neuroendocrine tumors. Okay. So second question to team E. Most common site of neuroendocrine tumor in GI tract.
Appendix.
Yes, that's the right answer. So appendix is the most common site, and followed by the small intestine and the rectum. So 20 marks to team E. Okay. Then the team D. Select your set.
Hibiscus.
Hibiscus. Yes. So that is the national flower of Malaysia. Yes. Okay, so this is your first question. This 55-year-old gentleman present with the painless subcutaneous mass over foot, the multiple sinuses and a circulating discharge from the mass, and the dot in circle sign on MRI. So what is your diagnosis?
Mycetoma.
Yes, that's the right answer. Mycetoma or the Madura foot. So second question, which organism is most common cause of eumycetoma?
Aspergillus.
No, sorry, that's a wrong answer. Anyone from the audience?
Actinomyces.
Who is?
Actinomyces maturin.
That is the wrong answer. Just
Madura
actinomyces is the most common cause of actinomycetoma. That is caused by the bacteria.
Madura mycetoma.
Yes. So that is yes, the Madura mycetoma is the most common cause of eumycetoma, that is caused by the fungus. Okay. Good. So the next team C. Select your flower.
Set 1, lotus.
Lotus. Okay, the national flower of India. Yes. So this is your first question. A 38-year-old gentleman present with the rest pain. The ankle systolic pressure is less than 50 mm of mercury, and the ankle brachial pressure index is less than 0.4. So what is your diagnosis?
Critical limb ischemia.
That's the right answer. So critical limb ischemia, that is classically present with the recurrent acquiring pain for more than 2 weeks that require the more analgesia. This ankle systolic pressure less than 50, toe systolic pressure less than 30, and the ABPI is less than 0.4. So 20 marks. Second question, a buttock claudication in association with the sexual impotence resulting from the
Leriche
arterial
syndrome.
That's the right answer. So that's easy one. So total 40 marks to team C. Now coming to team B.
Marigold.
Yes,
Marigold. Set it.
marigold. So it is commonly used in Indian festival. Okay. And for decorations. Okay, so the question is, a 45-year-old gentleman present with this epigastric pain and distension, then unproductive retching or inability to omit, and inability to pass a nasogastric tube. So this is a classical triad. What is your diagnosis?
Gastric volvulus.
Yes, that's the right answer. Gastric volvulus, and this is a classical Bouchard's triad. So 20 marks. Second question, which type of gastric volvulus is more common?
Organoaxial.
That's the right answer. Organoaxial. So organoaxial is more common than the mesentericoaxial. So total 40 marks. Team B. Last team A. Select your flower.
Rose.
Rose. It is called as the queen of flowers. Ah, okay. So this is a 45-year-old woman, lady presented with the soft fluctuant swelling in the umbilical region, mobility perpendicular to the mesentery, and a zone of resonance all around. So what is your
Mesenteric cyst.
Yes,
A
that's the
triad.
yes, top triad and is classical triad of the mesenteric cyst. The second related question, the most accepted theory for the development of mesenteric cyst is
Lymphatic and lymphatic.
what lymphatic what?
Lymphatic.
No, that is the type. Most common developmental theory.
Development of the lymphatic system most common.
No, I have not given you the anyone from the audience. They just told the lymphatics, but what?
Blockage of efferent lymphatics.
Exactly.
No. So it is a lymphatic malformation. So basically, there is a this failure of the lymphatic channel to communicate with the venous system. That is the correct answer. You just said a lymphatic, so I will not give it to you. So 20 marks to team A. Okay. So this come to an end of this round. So I want to thank Dr. Siddharth Dubashi sir, Dr. Deepa madam, and Dr. Prachi madam for giving me the opportunity to conduct this round. Okay. So thank you so much and all the best.
Good afternoon, all.
So now we will solve some mystery, right? You are being a true detective now and you will follow some clues and avoid the traps and then solve the mystery. So I'll state the rules and I will take few minutes to state it clearly. There will be 4 clues for each mystery and you have to choose the mysteries from the mystery board. Okay, so you can choose it randomly amongst, there will be 9 mystery and you can choose anyone from that 9. So the first clue is what, 25 points, then 20, then 15, and the final clue is what, 10 points. So yes, the earlier you crack the mystery, higher you score. Okay. So all clues are interconnected. Every clue has a purpose. So listen those clues to carefully. I need a complete specific answer. Okay, your first answer will be considered as final answer, right? So sorry. So a wrong answer or no answer will be uh, will carry negative 5 marks. Okay. So wrong answer or incomplete answer. If you do not answer, then we'll move on to the next clue. If you give wrong answer also, you will go to the next clue. But if you give incomplete answer on your first attempt or wrong answer, that will carry negative 5 marks. So if you incorrectly answer all 4 clues, then you will get minus 20. Okay. So teams, please remember, do not rush. Okay, do not jump early. Wait, listen to the clue carefully, and then give me a final complete answer. And if you are confident, then answer early. Otherwise, it is better to wait for the next. Okay. So after every wrong answer or no answer, we'll go to the next clue. And when you give a correct answer on any clue, you will get to unlock a bonus question. Okay. So bonus question is what? 10 marks. There is no negative marks for bonus question. If you answer it correctly, then you will get 10 marks. No, if you don't answer it, then nil. Okay. So question and clues will not pass to the next team. No negative marking. And after the clues are stated, then the question will pass to the audience. Right? Any doubt? I will throw a question to the audience first. You can see how it is being conducted, and then if any doubt, you can ask me directly. So, audience question. Okay, you will get 15 seconds after I finish reading the clue. Okay, a famous pressure time curve from the mathematician tells the story of this injury. There is a sudden pressure rise, a rapid fall, and may even dip below baseline before returning to normal. So what specific injury I am talking about? Anyone from the audience? You will get 15 seconds. If nobody from the audience is taking this risk, then I will go to the next clue. The injury is not caused by any fragments, any burns or any body being thrown. It is caused by the pressure wave itself with maximum damage where gas meets tissue or fluid. Is it clearer with the next clue? Yes, sir. It seems no student is answering. Can you please answer? Yes. So, sir told blast injury, but I was looking for primary blast injury. That will be the specific answer. So, if it is incomplete, then you will get negative 5. So, please remember, don't jump early, think and then tell the answer. So, if somebody tell the correct answer, I will run through the next clues. The next clue was the skin may remain silent while the inside is injured, the lung may become white, the ear may bleed, and the bowel may perforate later, even without a penetrating wound. So that is typical features of primary blast injury. Okay. And the fourth one is an X-ray showing bilateral lung lesions, and that is typical of blast lung. Okay. So this was the answer, primary blast injury, and the mathematician was Friedlander, whose curve was being described for the primary blast injuries. And the bonus question is in blast injury classification, what is the term for injuries caused by biologically active or chemically active or radiologically active material released by the explosive device? Anybody from the audience? What is the term? So we talked about primary blast. What is this injury is called? Anyone? So it is quinary. It is quinary blast injury, primary, secondary, tertiary, quaternary, and then comes the quinary. So these are all taken from belly lab. Don't worry, our question, the team's question will be easier. It is only for audience. Okay. So should we go? Everything is clear? Rules are clear? Okay. So I'll start from team A, right? Here is our mystery. Team A, please choose from the mystery board. Which one you choose?
Mystery 7.
Mystery 7. Okay, let's see which mystery I would see. So the first clue, team A, this is a trauma clue and I want a specific name of the condition. Okay, not a generalized answer. So be careful before you jump to the answer. In 1863, a 19th century French surgeon described a traumatic lesion that was not simply a bruise, not simply a hematoma, and not always a open wound. The danger was hidden beneath apparently intact skin. What traumatic lesion I am talking about? 15 seconds. Timekeeper, please. Okay. So your time is running out. So team A does not take the risk. Should we go to the next clue? Okay. So here 20 points clue for you. The skin may look deceptively viable, but the true extent is often underestimated. What is the lesion I am talking about? Time is running. 15 seconds. So time is out. I will reveal the next clue for them. They are not taking risk at all. So the third clue, it is a visual clue and the skin is present, but it has been separated from its lifeline. So that added another layer of to the disease, to the diagnosis. What is the diagnosis? No? You will not attempt to answer this clue? Okay. So fourth clue for them, it is the characteristic hemolymphatic collection of a close degloving injury, classically described over the greater trochanter. Time is running. So they have not attempted on fourth clue also. So they will not get the bonus point or bonus question. So anybody from audience, what is the lesion called? That internal degloving? Anybody? I can see one hand raised there. That lady.
Moral level.
Yes. Beautiful answer. It's a moral level relation. Okay. So the answer is moral leveling, and this is a close internal degloving injury that is typically seen in on the greater trochanter. So team A scores 0 from this mystery. Yes. Pardon? 0. Yes. Timer.
Timer is not visible.
Sir, they are keeping their watch on the time, so they will notify you if 15 seconds is over. Okay. So I'll go to the next team, team B. Which mystery you are choosing?
Mystery number 4.
4. Okay. So team B, this is a historical clue again. In the late 19th century, a French venereologist described a terrifying illness in previously healthy young men. Its onset was abrupt, its progression was rapid, and its cause initially seemed mysterious. What rapidly progressing surgical condition is hiding here? First 15 seconds. Time is running out. So time is up. So I will reveal the next clue for them. The outer envelope may die while the deeper resident survives. What is the lesion I am talking about? So again, time is up. They are not risking it. Fair enough. So I will go to the next clue. Now this is an image-based clue. Gas is seen where gas should never be.
So Foreigner's gangrene.
Excellent. Excellent. So they will get 15 points for this mystery. So I'll reveal the next clue for the audience. The surface may lie. What looks like limited skin inflammation may actually be a deep spreading catastrophe where visible margin underestimate the true disease. So that clue is very clear now. So they will get to open a bonus question. So here is your bonus question. Fournier's attacks the perineum. Its abdominal wall cousin carries another name. What is that?
Melanese ulcer.
Excellent answer. So 10 additional point for them. Team B. So do we go to the team C now? Okay. Team C, which mystery?
Mystery one.
One?
Yes.
Okay. So here is your first clue, team A, team C, sorry. And in the year 1916, a professor of gynecology at Johns Hopkins Hospital described a striking discoloration seen in a life-threatening intra-abdominal emergency. What sign is hiding here? 15 seconds. I want a specific and complete answer.
Cullen's sign.
Wow, beautiful answer on the first attempt. Excellent.
Thank you.
Very nice. So he is right on the money. It is about Cullen's sign, who was a gynecologist who discovered this sign. And its absence is not reassuring, but its presence should make the surgeon search for serious internal or retroperitoneal bleed. And the third clue was its value uh, is not in diagnosis, but it has a mark on the central abdomen and is spread along the ligament of teres. And lastly, it is a image. Very nice. So they will unlock a bonus question. So here is the bonus question. So Cullen's sign is commonly associated with acute hemorrhagic pancreatitis. But this was not the emergency in which it was originally described. In which condition it was originally described?
Ectopic pregnancy.
Excellent. Excellent. So it was described in ruptured ectopic pregnancy by a gynecologist. Very good answer. So now we'll go to team D. Please, team D, which mystery you are choosing?
Mystery 6.
Mystery 6?
Yes.
Very good. So team D, this clue is about a deformity. A 19th century German professor of surgery name became attached to the permanent deformity that appears when this emergency is missed. But the deformity is only the scar left behind, and the real battle is fought much earlier. Which emergency is that? "15 seconds, time is running out." So they did not risk it. Then I will reveal the next clue. The main artery may still be open, but the muscle may already be starving. What condition I am talking about? I think time is running. So they did not answer on the second clue. So here is their third clue. Though not mandatory, but sometimes this needle may help. It does not look for pus, blood, or any joint space. What is the condition? So team D, they still did not answer to the third clue. So I will go to the fourth clue. The problem begins inside a closed anatomical box as pressure rises. What is the emergency I am talking about?
Compartment syndrome.
Yes, it is acute compartment syndrome, and they are able to answer it on fourth clue, so they get 10 points. So they have unlocked the bonus question, and this was the answer. And the bonus question is this: a surgeon performs fasciotomy for acute leg compartment syndrome. Inadequate decompression of one hidden posterior compartment can still leave muscle at risk, right? So, how many compartments need to be released in the leg?
2 compartments.
Wrong answer, I am afraid, but no negative mark for bonus. So, anybody from audience, how many compartments?
All 3 compartments.
Again, it is wrong. It is 4, right? There are 4 compartments: anterior, lateral, and posterior. There are 2 separate facial compartments. One is superficial and another is deep. Okay, so we need to release 4 compartments completely to decompress acute compartment leak syndrome. Okay, so they will not get the bonus mark here. I'll again go back to the mystery board, and the next mystery is for team E.
Mystery 5.
5, right. So first clue for team E, it was once called one of the most deceptive catastrophes in abdominal surgery. The patient suffers intensely, but the surgeons and find very little in the early hours. What emergency I'm talking about? So time is up for the first clue. So I'll reveal the second clue for them. The earliest damage begins in the most vulnerable inner line. If the process continues, a local event becomes a systemic disaster. So now we go inside the bowel wall. What is the emergency I'm talking about? So no answer on second clue. So I will go to third clue. In an elderly patient with an irregular pulse, a mismatch that should not be ignored. If the diagnosis is delayed, survival may come with a shortened intestine. What is the emergency I am talking about? I think they are playing pretty safe, not risking it. So, fourth clue, the scan shows the reason why the bowel is failing before the abdomen declares peritonitis. Can you see what is? Yes.
Acute mesenteric ischemia.
Yes, acute mesenteric ischemia. They have correctly answered it, and they will get 10 points for that fourth clue. So they have unlocked the bonus. Acute mesenteric ischemia is the answer, and this is the 10-point bonus question for them, which named meandering central collateral between the middle colic artery and the left colic artery may enlarge in chronic mesenteric arterial obstruction. Please read question carefully and then answer. You will get 15 seconds only. You could attend because it had no negative marks. So anybody from audience? So is any other answer from audience? Yes, it is arc of Riolan. The Drummond's is the peripheral connection. The central is arc of Riolan. Right answer. So the answer is the arc of Riolan. Next, I'll go to team F. So team F, which mystery you want to play?
Mystery 2.
2.
Yes.
Very good. So here is your first clue that takes us to St. George's Hospital, 1735. A surgeon operated on an 11-year-old boy with a long-standing groin swelling. and an external fistula. The operation became memorable not because the groin swelling was unusual, but because the surgeon found an unexpected resident inside the sac. Name the clinical condition. 15 seconds. This clue is for 25 points. So they have not attempted on the first clue. So next clue. It involves a structure derived from the midgut whose inflammation, perforation, or abscess can completely change the operative plan. What is the condition I am talking about?
This is Meckel's diverticulum lattice hernia.
I am afraid they will get negative 5 marks. All I told all clues were interconnected. So I'll run through the next clues, and the next clue was clinically often present like an incarcerated or strangulated hernia, and preoperative diagnosis is uncommon unless imaging is performed. And the last clue was visual clue that depicts a structure that is more than bowel or omentum, that is an appendix. And the hernia I was talking about is Amiant's hernia that was operated by Claudius Amiant, the surgeon. Okay, so they will get a negative 5 marks. Okay, and they will not get the bonus question. Okay, and the last question is for team G.
Sir, 8.
You want to play which one?
8, sir. Mystery 8.
Mystery 8? Yes. Okay. So team G, this clue begins inside the skull. Two Scottish physicians thought that the adult skull has very little space for negotiation. This emergency may allow a patient to talk before they die when negotiation fails. Which emergency is this?
EDH, extradural.
Excellent. Extradural hemorrhage is the right answer, and they get full 25 points. So the next clue was it is a collection that does not wander freely across the skull, and when seen through the lens, a lenticular shaped lesion, its limitation becomes its signature. And the fourth clue is that the culprit, usual culprit is middle meningeal artery that runs beneath the groove, beneath the one of the thinnest part of the skull, that is temporal bone. And the last clue was the image. So they get 25 points and they have unlocked the bonus. And the bonus question is, so in this case, in this image, if an uncal herniation occurs, which pupil dilates, which side of hemiplegia occurs? Please mention the specific side.
Carnahan's notch phenomena.
Wrong answer. I can't give it to you. Anybody from the audience? I told which side pupil dilate and which side hemiplegia occurs. I can see raised hand there.
Same side pupil dilates and contralateral hemiplegia.
Excellent. Excellent. So same side third nerve palsy will occur. Same side means which side? In this image, which side? Yes, left side pupil dilates and right side hemiplegia will occur. That will be the complete answer. So no point for bonus question for team G. So that concludes this round, I guess. Thank you. So I'll hand over the mic to Prachi ma'am for the next round.
Can we have the display, please? Yeah, it's there. So we have seen that surgery is all about mysteries, and we need detectives to solve those mysteries. But after all these frowns and a little bit of stress, I think we need to lighten up a bit, loosen up a bit, and enjoy some movies. Yeah? Okay. So here we go. The rules. Now, this is going to be a team specific round and we are going in the anti-clockwise direction. So we're going to start with team G. We are going to enjoy this music, the audio visual clues. So there is no negative marking. You can let your imagination run wild. A video clip will be shown and 2 questions related to the clip will be asked. The first question, if answered correctly, will earn 20 marks. The second question will then be displayed after you answer the first question. That will be for an additional 10 marks. If the team is unable to answer the first question, it will pass to the next team in the anti-clockwise direction for 10 marks and 5 marks respectively. In case the first team, the primary team, is able to answer the first question but not able to answer the second question correctly, it will pass to the audience directly. Clear? However, if the past team, that is the second team, is able to answer only the first question correctly, the primary team will get a second chance to answer the second question for 5 marks. Complicated, but for us, but I will announce the marks. And if the past team is able to answer only the first question, as I said, the primary team will have a second chance. The time allotted will be 20 seconds and 10 seconds for the first and second question respectively at the first go. Okay. So to prep you, let us prep the audience first.
Emergency procedures initiated. Please verbally state the nature of your injury. Cesarean. Error. This medpod is calibrated for male patients only and does not offer the procedure you have requested. Please seek medical assistance elsewhere. Session. Abdominal. Facing injuries. Poor buddy. Finishes. Running diagnostics. Oh, oh, oh. Initiating anesthetics. Commence surgical procedure.
So this was for the audience. As you can see, there is no surgeon here. The patient is operating upon herself. And clearly the anesthesia has not worked. First question to the audience. What is the level of robotic autonomy in this clip? Anyone? You can take a guess before I come to the front rows. Anyone? What is the level of robotic autonomy? Level? Who answered that? Yeah, please give me a reason. So, okay, because I said take a guess. Anyone in the front rows? Anyone here? No? Okay, so I give the answer. It is level 3, where the robot makes the surgery, but it needs approval. So there is a human operator there who is giving approval for this type of a procedure, and there are 5 levels of autonomy in a robot. Fortunately, we don't have the level 5 yet. Otherwise, surgeons will become an extinct species. So second part of this question, which was the first abdominal surgery to be performed robotically in the world? I'll make it more specific, which was the first GI surgery, which was first to be robotically performed. Yeah, cholecystectomy. Way back in 1997, yeah, he can have the chocolate, please. Way back on March 3rd, 1997, in Brussels, Belgium, by Dr. Jacques Himpens and Dr. Guy Bernard Cardier. So this was a long clip because I just wanted to wake you all up and make you interested in the clips to come. So, Team G, are you ready? Look at the clip carefully.
Transitions in color. Here's flooding. That's bad. Dr. Melendez, okay, what do we got? The sun's is flooding. It's the switching deck flow. This failing. We need decision now.
So look at the question. Question coming up. Name one likely delayed complication in a bare metal vascular stent. Your time starts now.
Migration.
Okay, since I have given you the question, you're correct because that is one of the delayed complications, displacement. The second question coming up. What is the immediate line of management in a blocked vascular stent? For 10 seconds.
Open removal.
Pardon?
Open surgery.
Wrong answer. The question passes to Team F.
Ma'am, how many marks to be given?
So they get 20 marks. Right. Wrong answer. Question passes to the audience. What is the immediate line of management in a blocked vascular stent? Yeah, one at a time, please, and please identify yourself. Get a stand up and answer. Anyone wants to take a go? Yeah, somewhere here in the middle. No, that's the wrong answer, I'm afraid, and I'm going to reveal the answer. So, the blocked stent itself can be inflated by using a drug-eluting stent. It is not easy or possible to remove a vascular stent. So, next question. So, team G gets 21. Next question to Team F. The video clip coming up.
I think my appendix burst. I gotta go to the hospital. Please carry me in a less emasculating way.
The pain you're experiencing is the result of impacted fecal matter in your colon.
Full of shit. Not really a diagnosis you want to get in front of the most popular kid at your school.
When was the last time you had a bowel movement?
16 days?
Oh my God.
Okay, due to the frankly incredible volume of waste in your body, we will need to perform a surgical procedure to remove it immediately.
Wait, what am I supposed to do? My parents are in Phoenix.
Is there another adult who can stay with you?
I'm 18. I can stay while you empty the shit from him. If there is a just and merciful God, just kill Ben.
Mr. Gross, it was a successful procedure. How do you feel? Now we just need you and your adult friend to wait here until you pass gas.
So how big a farm are we talking here, Doc?
Question to Team F. Which procedure is the doctor talking about? Is the time up? 20 seconds?
Colonoscopic decompression.
No, that's the wrong answer, I'm afraid. Question passes to Team E.
Bowel enema.
That's the wrong answer. Question passes to the audience. Which is the simple procedure which the doctor must have performed? Yeah? Manual removal of feces. So I have mentioned that it is not a surgical procedure. So this is a procedure and Team F do not get any marks, and nor do team E. The second question to this, you want to take a go again? Yeah. The second question, going back to team F, that was the answer. Which dynamic imaging technique is used in cases of obstructed defecation syndrome? For 10 marks and 10 seconds.
CCT.
Time is up. Audience? Yeah, somebody here.
Something.
Yeah.
Echography.
I'll grant it to you. It is defecating proctography. So you combine the two words, defecography. Okay. Next question. Team E. Team E. Have a look at the video. So that is an excellent green corridor we are talking about. Totally septic. But the question is, what is the indication for a heart transplant? Team E.
Dilated cardiomyopathy.
What is the indication? No. Question passes to team D.
HOCM,
Elaborate on that, please.
hypertrophic obstructive cardiomyopathy.
No. Question passes to the audience. What is the indication? So there is one.
Ischemic heart disease, ischemic cardiomyopathy.
No, I'm afraid the only one indication is it has to be an irreversible or end stage cardiac failure. All these things you have mentioned has some kind of treatment. So it is end stage cardiac failure. So second question, team E. Name a pulmonary contraindication for a heart transplant.
Pulmonary hypertension.
I'll grant it to you. So it is a fixed and severe pulmonary hypertension. So you get 10 marks. Next clue to team D. Watch your clip carefully.
Dr. Murphy's dividing the breast parenchyma into 3 pedicles. Anyone know where this technique is derived from?
Breast reduction surgery.
That's right. And why would I use a breast reduction technique to make the patient's breast larger?
The technique frees up the tissue. You can bring the pedicles together to make the breast smaller or spread them out over an implant to make it larger.
So the first question coming up for team D, 20 marks. Name the anatomical septum that divides the breast into upper and lower halves. No, 20 seconds.
Cooper, ligament of Cooper.
That's the wrong answer, I'm afraid. Question passes to team C. No. Question passes to the audience. Name the anatomical septum that divides the breast into upper and lower halves. I could. Congratulations, sir. That is the Boehringer septum. Question number 2 to team D. Name any 2 pedicled flaps used in autologous breast reconstruction for 10 marks.
TRAM and DIEP.
Congratulations, that is the correct answer. So you get 10 marks. LD flap, TRAM flap, DIEP. So next direct question to team C. Listen to the audio carefully.
The scans show a change from Dr. Cameron's original assessment. There was a complication from surgery, a lacerated bile duct and artery. You'll need another surgery to repair. Is that all? Yeah.
So if there was a confusion in understanding the accent, it was a cholecystectomy which they've been performed, and the doctor is telling the patient that there has been a lacerated bile duct injury. So the question coming up, in the P-safe method to assess safety in cholecystectomy, what does F stand for?
Umbilical fissure.
Great. So you scored 20 points. And the rest of the things, be safe is bile duct, sulcus of Rouvier, hepatic artery, umbilical fissure, and enteric component, that is the duodenum. So second question coming up, Team C for you. In Strasbourg classification of bile duct injury, what does type E injury indicate?
Both right and left hepatic duct.
Were they within time? Just in time. So I'll give it to you because it is a complete transaction. And so they get 10 marks for that. Team B, your clue coming up. Enjoy this clip as well as focusing on the answer on the questions.
Fight, fight, fight! Don't worry.
So none of us here are stupid enough to wear a wristwatch in the OT and put it inside the abdomen. But some accidents can happen in cases of children especially. So the question is, in case of accidental ingestion of small electronic devices by a child, Team B, what component of the device are we worried about?
Lead batteries.
Alkaline batteries, I'll give it to you, 20 marks. And the second question is, in this AP view of the X-ray of a child who has accidentally put a coin in its mouth, where is the coin likely to be?
Esophagus.
Correct answer. You've got the points already, full 30 marks. Can you elaborate why?
Ma'am, the esophagus is a collapsible tube which has a diameter in the transverse axis. So if a coin lodges in the esophagus, the AP view will be visible.
Great, congratulations. So that is in the esophagus. Team A, clip for you. Again, if this is not very clear, I'll just highlight what the dialogues are.
You present with a growth that unfortunately went undetected in stages 1, 2, and 3. Now it is an insidious adenocarcinoma.
Insidious.
Insidious means undetectable at an early stage.
Insidious means treacherous.
Shall I continue?
By all means.
In invasive epithelial carcinoma, the most effective treatment modality is a chemotherapeutic agent.
So the doctor is counseling her, telling her, breaking the news that she's suffering from a metastatic ovarian cancer. The question, what are the commonest sites of metastasis from ovarian cancer? Your time starts now.
Liver, peritoneum, Um,
What is
stomach, crooked tumor, and
okay? This
breast.
I will not grant it to you because the question, the answer was not perfect. Team G, you want to take a go?
Peritoneum.
Peritoneum is the first thing. So since you said liver as the first and Flukenberg and all, that is entirely the wrong answer. So bonus 10 marks to question to team G. Now you get a chance to answer the second question. Which genes are involved in hereditary breast and ovarian cancer syndrome?
BRCA1 gene.
Okay, I'll give it to you. It is anomaly in the BRCA1, BRCA2 genes. So they get 10 marks. Okay, so my questions are over, but I have one extra question. Can I play a small clip for the audience or I go ahead? Okay. So just a classical, simple question for the audience.
I'm feeling sweaty. Do I look sweat? I need to use the bathroom one more time.
It's like 5 times in an hour. Well, somebody's nervous about the ceremony. I don't blame him. He didn't exactly think Partridge is the most popular guy in town. Huh? My God. You okay?
I think I'm giving birth. Is that possible? No, right?
Oh, no.
Oh, God.
I'll call an ambulance.
No, God, it's twins. I'm having twins.
Okay.
So what can be as severe as giving birth? Okay. One of the differential diagnosis, but if you heard the dialogue carefully, he's been going to the washroom all the time. So it is ureteric colic. And the last question, name one highly sensitive and specific investigation to be performed in cases of acute flank pain. Yeah, so one of the teams here has already answered. It is non-contrast CT scan. And that is the end of our now. Thank you.
Yeah, correct. I invite Smarka sir to announce the scores after the fourth round.
Okay, after the fourth round, we will announce the score so that whatever the teams lag behind, they will buck up now. Like this. So UPMC Jalgaon having a 70 marks. GMC Sambhaji Nagar 175. AIMS Nagpur 165. NKP SIMS Nagpur 100. GMC Vidisha 80. MSIMS Sevagram 75. JNMC Savangi 95. Okay. So buck up now from last 3 rounds. All the best.
Good afternoon, everybody. You have already heard the round, and I think there's a tough competition. So I'm gonna get a super split round for you guys. So you have to wake up now because this round is gonna be the game changer here. Whatever happened. You have to buck up and be ready for round. So these rounds will be based on specialty, super specialties, where 3 questions will be asked. There are general rules here. I'm Dr. Raj Vilas. I'm surgical gastroenterologist, and I'll give you a run through this buzzer round. So this round, the questions are based on subspecialties of general surgery. This will be a buzzer round. The team buzzing first will be eligible for answering. But mind you, you have to answer within 15 seconds. If you don't answer, or if the time is passed, you will not be allowed to answer it again. This is non-passable round.
first answer coming from anybody of the three's mouth will be considered as a final answer. No correction in the answer will be allowed. No half answers are allowed. So for each correct answer, you will get 20 marks. For each negative answer, or if you do not answer, then you will get a minus 10 marks. So there are 7 sets of questions, 3 questions in each set, and every question you need to put buzzer to get the answers. So the maximum gain you can have is 420 marks. That is whoopingly high reward, but at the cost of a risk of 210 points will be negative. It's a non-passable round, and the decision of judges and quiz masters will be final. I'll request judges to just give me which set to be asked so that we can have that ball rolling. So it's a dummy question for audience. So which one to be taken, sir? D2. So let's go for D2. D2, the questions will be on neurosurgery, correct? So first question I'll ask, the moment the question is seen, the team can buzz and answer. For this is a audience question, so I will not ask you to buzz at this moment. Yeah, you can test the buzzer. We can see that. Check everybody for their buzzer. Fine. So what we can do is, I'll the moment the question is open.
Me, sir.
Yeah. So we already tested once. Don't test one by one. First, please close off. You can test first. Yours test. Wait, just a minute. Yeah, team B now. Buzzer. Check the buzzer. Yeah, stop. Yeah. So our buzzer visible in the front area. Yeah. Team C, buzz it. Yeah, great. Now team D, buzz. Press it. Correct. Wait. Press again. Yeah, perfect. Team G. So everybody's buzzer is working fine. So let's take this dummy question first. Okay. The moment the question is displayed, you can set the buzzer, but the answer will be given by the audience. Okay. Get set. Get yourself ready. Squeeze the adrenals. Okay. Be attentive. And the question rolls now. Identify the catheter shown in the figure. Correct. So now in this case, the team B was the buzzer first. That's why they are continuously, the light is on. So answer from the audience, please. Perfect. So this is a ventricular peritoneal shunt. So again, from the second question, keep ready with the buzzers. Question 2 on the screens now. Normal rate of production of CSF in normal adult is. So now team C has buzzed first. So answer from the audience. Anybody? I think everybody is still sleeping, isn't it? So I'll tell the answer. So it's 20 to 25 ml per hour. Now third question. Again, be ready with your buzzers, guys. What is the causative agent for Creutzfeldt-Jakob disease? So now team C has buzzed first. So now in that scenario, they will have to answer. If they don't answer, it will be a negative marking. So answer from the audience.
Brian.
Perfect. Brian, this is the correct answer. So ready now? All the best, guys. Back up. So request judges to let me know which specialty to start with, sir. Chalo. Hepatobiliary surgery. Be ready, guys. So HPV surgery, the next question, first question will be on HPV surgery. Be ready with the buzzers. All the best. The question 1 comes now. Who first described preoperative portal vein embolization for increasing liver volume in liver surgery? So team F is the one buzzed. Answer please.
Nimira.
So your answer is wrong. It is Makuchi who described it in 1984. So team F will have minus 10 marks for this question. Okay, be ready because it is do or die. You're gonna get full marks, but you're gonna get bleed also in that. Okay, so next second question in hepatobiliary surgery is, see the figure in the schematic representation of ampulla of Vater, which sphincter is represented by number 2? G team.
Sir, inferior choledochus filter.
Perfect. The inferior choledochus. So they will get full 20 marks. Congratulations. Ready again? So the third question, hepatobiliary surgery. What is the optimal time for surgery for biliary atresia to get best possible outcomes?
Within 60 days.
Perfect. 20 full marks to team C. Congratulations, guys. So this how we got first system rolled out. So 3 questions done. So again, next set of questions from our Christian guests, judges. So these are the total grade. So from this we have to ask. Great. Oh, sorry. Sorry. Endocrine surgery. The question 1. What is the instrument shown in the picture? Team E is the buzzer one.
Joel's thyroid retractor.
Perfect. Full 20 marks to team E. 20 marks, sir. So you have to be quick. Your reflexes has to be sharpened. That's why I said squeeze your adrenals, be attentive, and be quick in your reflexes. So question 2 from endocrine surgery. Where is the electrode placed to monitor RL and recurrent laryngeal nerve intraoperatively in intermittent nerve monitoring? So time is running. It's only 15 seconds. This is scorekeepers. The time is over. So time is over. I guess nobody wanted to answer it. So any answer from audience? Any answer from audience, please? No, no, no. So this is inserted transorally. So the answer is on the endotracheal tube between the vocal cords. So anyways, nobody will score here, but none of them will get any negative marks here. So this question will lead 0 marks to everybody. So the third question is, what is the Miami criteria for intraoperative monitoring of parathormone in parathyroid surgery in a functional parathyroid tumors? So now I think team C is the answer. You have to give complete answer.
After removal of parathyroid adenoma, there should be reduction in 50% in parathyroid hormone within 10 to 15 minutes.
Perfect. Team C, they will get complete 20 marks. So there has to be either parathormone should drop to normal or that should go to the half of the maximum level within 10 minutes of removal. So this completes endocrine bucket. Now let's go for third one. So which one to choose? Bariatric surgery. So ready guys? Keep your hands steady. So bariatric surgery, first question is, one anastomosis gastric bypass, also known as mini gastric bypass, was first described by. Reasonably simple question, isn't it? One of the MCQs in our pre-operative entrance exam. Time is ticking. Oh, team A
Roux-en-Y.
was described by. I want the name of the scientist. Unfortunately, the answer is wrong because the first word comes from my mouth is the answer, and Roux-en-Y is not a name of any surgeon. Okay, so it's a minus 10 marks. So this was described by Robert Rutledge, who was a trauma surgeon who described mini gastric bypass. So minus 10 for team A. So question 2 is, ready with your hands, ready with reflexes. So what is the procedure described in the figure? Very simple questions, very simple answer. Yes, team F.
Esophageal jejunostomy.
Oh my dear, how can you see anastomosis between esophagus and jejunum here? It's a bariatric surgery, and the answer is Roux-en-Y gastric
Roux-en-Y.
bypass. So you lost 10 marks here again. So it's non-passable, right? So next question. What is the length of the common channel for biliopancreatic diversion with duodenal switch? That is BPD/DS.
50.
Team D, give accurate and correct answer.
100 to 125 centimeters.
Yes, that is allowed. So the distance between 75 to 125 centimeter, which is given for adequate weight loss. So team D will get 20 marks for this. So this also completes bariatric surgery. Next question, sir. Which system we choose? So colorectal surgery. So again, be ready with your hands and reflexes. Question 1. What is the procedure described in the picture in the treatment of rectal prolapse? So team C will answer.
Thiersch wiring.
I'm sorry, dear, you cannot see any wire here, right? So this is not a procedure where, I mean, in Thiersch wiring, we don't expose so much. This is more of a resection procedure. So the procedure is Ultimates procedure. So you lose 10 marks here. So minus 10 for team C. So be ready for the next question. Who described J pouch for ideal pouch in anastomosis first? Here we want name of the person. Time is ticking. Question for 20 marks. Nobody want to take the risk? So time up. Question for the audience. Anybody? So I'll open the answer. So it's a Utsunomiya who first described it. I know it was a little difficult question here. So question 3, be ready with your reflexes. What is the commonest site of perforation in a closed loop sigmoid obstruction with a competent IC wall? Quite a clinical question. Those who are going to ward might answer it well. Time is ticking. Time up. Sir, do we give them a chance to answer? It was almost similar. No. The time was up. So answer. The question is open to audience. Cecum. Perfect. So closed loop obstruction, cecum has highest diameter, hence maximum chance of perforation. So which we have 3 more systems to go. Which one, sir? Plastic surgery. So plastic surgery, the question coming up is, what is the preferred time of division of pedicle for a pedicle groin flap? Time starts now. These questions are from Bailey. Not a single answer is outside Bailey. Time is ticking. So I guess nobody wants to have negative marks now. Who want to lose marks? So question for our audience. Anybody in audience? Perfect. So 3 weeks is the ideal time where we should divide this, and then we keep on separating the fingers. So next question again for the teams. Be ready. What is the device shown in the figure? So it's team E who has buzzed first. Give a complete answer.
Humphrey's knife.
I'm sorry, dear. Humphrey's knife is not like this. So this is a minus 10 marks. This is called as dermatome or a power dermatome. Okay, so minus 10 marks for team E here. Or scorekeepers, we got it right. So next question. So third question from plastic surgery. Be ready. Muscle flaps are classified by Mathis and Nahai as per their vascularity. What is the type of rectus abdominis flap? Team A, answer please. Time is ticking.
Axial flap.
I'm sorry, dear. These are classified class type 1 to type 4, and this is type 3 flap. So your answer is wrong. So you're going to lose 10 marks here. Perfect. So, but one last system to choose from with our judges. Sir, which one to go? Urology. So be ready with your reflexes again. Question 1 on the screen. Which classification used to classify cystic lesions of kidney? Team D should answer.
Bosniak classification.
Perfect. Plus 20 marks to you for placement classification of renal cyst. Yeah. Chalo, the next question again. Pretty simple questions, right? Some of them. What is the device or process is shown in the figure? Time starts now. I have never seen it, I guess, but at least in book you must have seen it. This picture is from Love and Bailey. Chapter Urology. Time is over. Audience, who would like to answer this question? Yes, please. Perfect. Chocolate for him here. He has given perfectly correct answer. So it's an artificial urinary sphincter. Question 3. So last question from the urinary system. What is the incidence of undescended testes in a premature male infant? So team B has buzzed first. 1 in 600 is 0.6%. So which is a very, very less chance. That is in normal children. In premature is 15 to 30%. So it's a completely wrong answer. Minus 10 marks. Team B. Yeah. So this completes serology. So we head for a last system. Sir, which one to choose? Cardiothoracic or a transplant surgery? So transplantation, it will be last set. Be ready, guys. So the question on screen, what is the type of liver transplantation shown and depicted in this figure? See the figures appropriately and then buzz.
Domino liver transplant.
Sorry, dear, this is not a domino. This is APOLT, that is auxiliary partial orthotopic liver transplantation. We remove part of liver and implant part 1. So team C loses 10 marks here, minus 10 here. Domino is you put that removed liver to somebody else's body. So question 2 is, who performed first pancreatic transplantation? Team F.
Joseph Murray.
Sorry, dear, it's Kelly and Lille who did first pancreatic transplant. So minus 10 for team F as well. So last question of this buzzer round. Ready? What is the maximum size of tumor to be within UCSF criteria for transplantation for HCC? Team D.
A single tumor of more than 6.5 centimeter or 2 to 3 tumor up to 4.5 centimeter.
So I'll give you marks. 6.5 centimeter is the answer. Congratulations, you get 20 marks from this round.
Minus 10 meter.
Thank you. I'll call Qureshi sir for the next round. I hope you have calculated yourself. I hope everybody was positive at the end of the round. That's what I'm praying for.
All right. The first thing is appreciation of all the students who are here. During lunchtime, they are answering difficult questions. Okay. So a big round of applause. That is all also meant to keep you awake. Okay. Uh, there's a lot of positivity, but the marks were for most often were negative. Isn't it? So we saw a lot of negative marking. But you can relax now. This is a loop round. All of you will score in this. This is going to be, I'll tell you the rules straight away. All right, here are the rules. So you have 20 seconds to answer a little more time, a direct question. And answer time begins immediately after the question is completed. So this is for the timers, 20 seconds after the question is completed. In case of a wrong answer, it passes to the next team in the clockwise direction and they get 5 seconds to answer. Answer to a direct question gets 20 marks and to a past question 10 marks. There will be no negative marking. Okay, so that's the good thing about it. Now, can I go clockwise? I think it doesn't matter much. Last round, I think is it okay, guys? All right. So we'll go clockwise only, A, B, C, D. So I'm more oriented to that kind of scheme. Do you have any questions regarding this? So what I'll do is straight away I'll go to a trial ball, which is meant for the audience, but it will also serve for you to know what kind of things are going to come. So this is my favorite clue. It's the trial ball, but it's a fast ball because it is being bowled by a pacer. So Lee was handed the ball to remove Chaminda once for all. No sharp cutter was used for his fall. All tail enders were out without scoring. Twice in 3 months, boss. No kidding. So those who have seen this on public domain or in the last quiz, please don't answer. Let somebody solve an answer rather than just blurting out the answer. So the new guys who have come, if they want to take a chance, anybody who has solved now, right now in the hall. All right. So I will go with the answer. Anybody wants to answer? Anybody who knows the answer? Yeah. So the veterans in the audience are answering it. So I'll tell you how this is made and this is the answer. By the way, this was asked in one of the quizzes and it was answered by a team from MGIMS. I still remember. So Lee was handed the ball to remove Chaminda is for Vas and Lee is not for Brett Lee. It is for Chiang Kai Lee who started this non-scalpel vasectomy in China. And no sharp cutter was used, obviously, is a reference to no sharp scalpel which is being used, was used for his fall. All tail enders were out without scoring is for sperms, and twice in 3 months is the WHO protocol to see azoospermia before you ask the patient to stop other methods of contraception. This incidentally has been published in the Indian Journal of Surgery, so it is available by the name of syndromic rhyme. If you put that, you will see this answer. By the way, the clues are not so tough, and I have marked a few important clues by a red color. So you can try and go for your hunches because there are no negative marks. So is team A ready? Okay, so here is your question. Anil Kapoor shouted in delight as he was cruising with Tom in American rivers, but the kissing was bugging him all night. Or was it just the reverse? At long last, his meals lasted long, and until wash down stayed on and on. In the test done from the mouth, there was no relaxation in the south. Waves in the body were some, and then they were none. So at Chicago, they awarded him the sine qua non. I want the complete answer and a specific answer. 20 seconds.
Okay, let's hear cardio.
Beg your pardon?
Okay, let's hear cardio.
No, I want a specific answer.
Second.
No, I think I'll pass it.
Redo with bug bite causing Chagas disease, causing
Exactly. So this is the answer I wanted.
trypanosoma chagasi.
Okay. So bonus mark to team B. I'll tell you why I have done that because half the page is meant for the Chagas disease. Okay. So I cannot give it for achalasia. So don't do cherry picking in this. You can land up with cherry picking because there will be clues in that, and there will be multiple clues. Saying only carcinoma will not be enough. Saying only classification will not be enough. Or saying just you will have to tell the organ because there are clues meant for those things also. So see the complete thing and then answer. So I mean the first line itself tells you some kind of clue. What does Anil Kapoor do in Delight most of the time? What does he shout? So the answer is there. Okay. As he was cruising with Tom in American rivers. Okay. So American and cruising is for cruising is there, American is there. It is most common in Central America. But the kissing was bugging him all night, or was it just the reverse? That means the bug was kissing him. So they actually hit you on the face, and these are also known as, by the way, kissing bugs. So Reduvit is right. Reduvit is a bug which actually bites you on the face. Not very common in this part of the world. At long last, I have kept a gap between the upper part and the lower part. So it's a chronicity which is shown. And then you will see that these complaints will start cardiac and the esophageal. Okay. So food stays for a long time. Water is required to wash down. No relaxation. In the south is non-relaxation of the NES. No waves in the body is the sine qua non, misspelled intentionally because the stars are involved. It is actually spelled by the S. Okay. And Chicago classification, of course, is there. Team B, are you ready? Okay. So here's your question. This was the answer to the last question. All right. So here it comes. Leo was 50 and was making Kit Kat by the day after getting GI tag along with friend TK. Hers, his were 50-50. The percentage chance of finding him here was also 50. He started eating but soon said nah. Early morning, he was shocked to see a male of a femina. Confirmation was difficult due to the hedge. So US targeted it and removed it along with a wedge. Meanwhile, at IMA, NIP was having tea. Before the strike and also after was a good strategy. What are we talking about? Complete answer. 20 seconds. C, team C. Give it a shot. No negative marking. 5 seconds and even before I say 5 seconds. So next team D.
Gist.
With gist. Team E, do you have the answer? The next team.
Gist with a primary resistance to imatinib.
No. Next team. G. Complete answer. Okay. Who said gist first? So I'll give it to you. So it's a gastric gist, but nobody said anything else. So that was the first team which came near to the answer. They can be given 10. Okay. So this is how it is. All right. So here's the answer and explanation to this. Leo was 50 and was making Kit Kat by the day. So Leo is leiomyoma and leiomyosarcoma have now been GI tagged. Actually, they have become now GIST. Okay. So he was 50. That is a common age beyond that. And Kit Kat is for C Kit, where Kit, there is no full form. Kit is actually a cat. Okay. So Zuckerman and Hardy had a cat on which they were working, which is also known as the feline sarcoma on which they were working. So it was on the virus and now it has come on the cell. So C Kit. Okay. Hers and his were 50-50, which means the sex was equal. And by the way, Hershey's is a company under whose license you get Kit Kat. So it's Hershey's also. The percentage chance of finding him here was about 50. So that is the stomach. Okay. He started eating but soon said, nah, is early satiety. And early morning, he was shocked to see a male of a femina is melina. So he should have answered upper GI bleed. And I mean, this was expected. Confirmation was difficult due to the hedge is because of the mucosa and covering it. Is you don't usually get the biopsy. That is where you start thinking of either a lymphoma or GIST and ultrasound targeted biopsy. Meanwhile, at IMA, NIP was taking T. What is this? So imatinib. So IMA strike was going on. So when this was made, so strike and after strike was, I mean, it fits in there as a distractor. And NIB also is there for a good reason. NIB is for Nib Sohendra, who is an Indonesian-born German who started these techniques, hybrid techniques of endoscopy plus laparoscopy for removal of intragastric tumors. All right, not directly related to GIST, but has done a lot of work in that area. So before strike and after strike is neoadjuvant and adjuvant, both work well in imatinib usage. Okay, so that's it. Which team comes next as a direct question? Team C, you are ready? Here's the question. She jogged before she could run. She reached the finishing line with a parched tongue. You know, Lar, said Ular in vernacular. She couldn't hold back her tears as there were none. There was a touch of single malt to her lips near the gums as she found herself in the company of Venus Williams. Auntie Rosa and Auntie Lasby identified her by a quirk, but the bark of a cinchona or the roar of the D Mart didn't work. Finally, the cry brought the joy. Which condition are we talking about?
Sir, this is Jogren syndrome.
Exactly. This is, this is correct. Complete answer. Okay, which clues did you pick up?
Sir, I parched tongue, that is dry tongue, then Euler criteria used for classification.
Yeah.
She is not able to produce tears.
Yeah.
Then RO and SSA and
Wonderful.
antibodies are present, and the DMARDs don't work there, so we would steroids and quinine for that.
Absolutely correct. Okay. So for the smart ones, the first line has given the answer. If you see the first line, she jogged before she could run. Jogran is there in the first line. So the smart ones could have done that. And you know lar in Hindi. So in vernacular, lar is actually salivation. Okay. So ular is of course the classification, which requires 5 criteria. All right. So I think you have said everything. We'll not waste time. Team D, are you ready? All right. So here's your question. Since birth, Bermuda's geometry was weak, so all the matter from Pandora's box could sneak. He came over the belt and rhymed with it. His fellow came below the petticoat, when off the coat chimed with it. Pros and cons of the problem was his thesis. Their method was to bring the latter to the former and suffix it. Next jinx was where and how to fix it. The problem was that the bone was a bone of contention, and as a solution, the bone was the one in contention. What are we talking about? Twenty seconds. Next team, Team E. F. G.
Prosthetic limb.
Sir, it is hernia. Hazelback's triangle, Bermuda triangle, it is negative.
Which?
Hernia,
Hazelback, did you say?
but, but I'm telling Bermuda geometry.
No, I want the answer.
Direct inguinal hernia. Direct inguinal hernia.
No, wrong. B.
Femoral hernia.
Wrong. C.
Obturator hernia.
Wrong. D. I think you have already answered. I think we started with you. Oh, so you are not telling me. I can't go on and on like this. Only few more hernias are left. Anybody in the audience? Just few more hernias left, right? Huh? Yeah, so lumbar is left, so that would be. So, see, I have changed it. I have shown it to some students at my home, and I could make some changes there. I had just started this clue with Bermuda's geometry, and I was told the triangle could be anywhere. So, since birth it is, okay, that is also important. So, Bermuda's geometry, you got it right, is a triangle, and it is weak, and Pandora's box is abdomen, so it's a hernia. That's not a big gain. All right. So, the thing is, it's a weakness since birth. There are many more clues which will take you to the lumbar hernia. He came over the belt and rhymed with it. What is the other name of lumbar hernia? Greenfield Petit, okay, or Greenfield less shaft and Petit if you want to see. So Greenfield, it rhymes with belt. The fellow came. The fellow is a little low. The petty triangle or petty's hernia is a little low. It came below the petticoat and then off the coat. When you remove the coat from petticoat, it chimed with it. It's a homonym. Okay. So this is not expected from you in 20 seconds, but it is the clue which is there for those who want to pick it up. Pros and cons of the problem was his thesis. Their method was to bring the latter. Latter means thesis को आपको pros में लाना है and suffix it. So it becomes prosthesis. So you're using a mesh. The problem is where do you fix it? It's a big problem in lumbar. Because of the space and the bones, you can't suture it. But the thing is, there's nothing else, so you have to finally do it. So although it's a bone of contention, it is the one in contention to fix it. That is how. Okay. So it was difficult, but not so difficult. All right. Which is the next team which is taking the direct question? E. Okay. You are ready? So here's your question. Some were outside and present in part or whole. Others outpouch from a side hole. The third had a scope to be seen from within. The fourth was outside as well as in. Then came Ollie's car in the reverse to be parked in the garage. Said so in 1977 Shri Takkuji Maharaj. What are we talking? I want the complete answer. This is 14E and your time is running out. Next team, F. G.
Choreographical system.
What is it about? All right, I'll give it
The
to
classification.
you. Which classification?
Tadani.
Okay.
Todani.
So actually, so Todani is right. You were struggling with the answer, but I'll give it to you. It's not so difficult. All right. So political system is fine. Some were outside and present. Some were outside, and those who were present outside were present in part or whole. So either a fusiform or a cystic variety. Others outpouch from a side is a diverticular variety, the type 2. The type 3 is a choledococele, which can be seen and treated from within, all right, endoscopically. Fourth was outside as well as in. The fourth variety is both in the liver as well as in the CBD. Then came Oli scar in the reverse, scar Oli. So, which is parked in the garage, which the garage is the hub is the liver. Said so in 1977, who is Takuji Maharaj? What is the first name of Tolani? It is given in Bailey. Takuji is Tolani. Okay. So that is the answer. All right. So things are easy if you see them completely. All right. So next team is which team? F, is it? All right. So F, direct question. Here it comes. He asked St. Peter's, why am I at the gates of Tartar, surrounded by hellmates, when I never carried one in decades? In a fight for space, when four people jostle, one has to leave the rigid box, said the apostle. My son, your uncle passed out before you passed away. After the long pressing prayers, all were waiting for Amen to slip toward the pathway of outward. The triad showing the signs of times was given by Harvey of Harvard. Which doctrine are we talking about? Twenty seconds. G. Five seconds. Next, I'm sorry, your time is over. A.
Pearson's hernia.
No, sorry. B.
Monroe.
Correct. You said Monroe Kelly? Just to be confirmed, yeah, they are right. So it's the Monroe Kelly doctrine. Actually, these questions were asked earlier in the part of the quiz. If you were listening to it carefully, I told the others don't change anything. It won't matter much. So you've got 10 marks as a bonus. Now let's see how this is made. St. Peter's actually is somebody who sits on the in the heaven, and Tartar is the hell. So this is a not very relevant part for you. If you don't know, it's okay. But he's asking after this man is dead. First thing is this man is dead. All right. Surrounded by helmets. All right. So it is a homonym for helmets. When I never carried one in decades. So this fellow has head injury because has not used helmet and has reached to the health. So there's a message also. In fight for space, when four people jostle, one has to leave the rigid box is the clue. This is the skull. All right. Said the apostle. My son, your uncle passed out. What is that? Uncle herniation at the tentorial level. That is the first thing. After the long pressing prayer, that is, the pressure is still on. All were waiting for amen. Is foramen magnum, from which everything is slipping out one by one. So then there will be the tonsillar herniation. The triad, of course, is what triad? Harvard is Cushing. Harvey Cushing from Harvard University. So the Cushing's triad is showing signs of time is something which you see clinically. And we are talking about a physiological principle of Monroe Kelly doctrine. So that's the answer. Good answer. I think it was team B. All right. So this is Genong. Okay, if you have read your physiology well. One more team left. G. Okay. So this is the last question. Direct one. Here it comes. He was almost always on the right and stayed right behind, as the cardinal at the back was left behind. The party was hooked on to the fish as he stopped the flow. So the tubes bloated and the cups ballooned. So to flip the J, they brought the DJ. It was all in vain, as the vein was the pain. So they cut the kink where it was pink and joined it after bringing it to the fore. Now I and we could see the free flow in the front as Mr. Blean slowly started his daily chore.
Retrocable ureter.
Absolutely correct. Wonderful answer. You made my day. All right. So you see, it requires lot of efforts to make this. And if it is not answered, you look like a fool. Very good answer. Okay. So he was always on the right. So it's always on the right because the problem is on the right, and stayed right behind the kava. So right behind. As the cardinal at the back was left behind, it is the persistent of the posterior cardinal vein which leads to all the problems. All right. So the tube bloated, which is the ureter, and the cups balloon. So initial stage of hydronephrosis is cupping, and then it becomes like a balloon. So to flip the J, that is the reverse J sign, they try to put in a DJ. You just straighten it up and try that. So this is just a temporary method. If it doesn't work, finally you'll have to do a surgery where you cut it, bring it in front, okay, and then suture it. All right. And as Mr. Bean is for, of course, the kidney. So I've got two questions, but I'll just take one more. If you want to, I can give it. I mean, it depends on the crowd. One audience I would like to. All right. So this is some liberty I've taken for the audience, but let's see if everybody is awake. Here's the question. This hard nut of Sialkot blocked the straight of our moves due to the conduct of his old friend, son of a gun, as Trump popped his cheeks at the sight of lime and lemon. Anybody in audience? It's an easy one. Somebody will have to raise the hand, stand, tell the name. Sir, पीछे से आने दो. Any student there? Yeah, you can stand and speak.
Xylolithiasis.
Xylolithiasis. Okay, I'll give it to you. Which xylolithiasis? Which xylolithiasis?
Sublingual.
हाँ, तो वो मुझे मालूम था. ये वो क्या कर रहा है ट्रम्प? वो सबलिंगुअल में ऐसा करेगा क्या? So you're right. Xylolithiasis is most common in the submandibular, but this question is framed on parotid. All right. So this is how it has been made. The hard nut of Sialkot. What is Sialkot? Sialkot actually is spelled K. Okay, but it is coated with Sial means saliva. So hard nut. It's an easy clue. Block the straight of our moves. Okay, so it is coming in there. Purposely put it in Hindi. Due to the conduct of his old friend, son of a gun. What is that? Which duct is there in the parotid? So Stenson. So Sten is a gun and son is a son. So son of a gun. All right. And by the way, son of a gun is not a derogatory term which most people think. It is a dependable friend. So they are there. The stones are there. All right. As Trump popped his cheek, this was a very viral reel of Trump. Because of the frustration, he was just blowing those cheeks at the sight of lime and lemon. So that is it. I have one more question, but I think I can call it a day. Thank you.
So now we are coming to the end of the quiz scores.
Yeah.
You want to announce?
My announcement. Okay, before we go to the last round, all guys, be ready. So here is now AIMS Nagpur 205. GMC Sambhajinagar 185. NKPC Nagpur 170. JNMC Savangi 145. GMC Vidisha 9090. PMC Jalgaon 5050. Sevagram JMS 45. That all your scores. So now Bakab, AIMS Nagpur, Sambhajinagar, MC Nagpur, and JNMC Savangi. Okay, oh, all the best for next round.
Thank you, sir. So you know what are your scores. So you know how much you can risk yourself, right? So this is a very important round. It is a rapid fire round. So we will be asking questions, and then this round is also having negative marks. So play it very cautiously because whatever you answer, I will consider that as the answer, right? So we will be starting with this round. I will tell you the rules. Right. So here are the rules. So this will be anti-clockwise. So we will, sir has just taken it clockwise, so I will take it anti-clockwise. So there will be 11 sets. Each team is allowed to select one available set at that time. Each set will have 8 questions to be answered in 75 seconds. That is 1 minute, 15 seconds. The timer will start after the display of first question. It is incorporated there only. All the answers are either single word or just one or two line, one line. Team members can decide one spokesperson to answer to avoid double answers. Answer once given will be considered as final answer. Each correct response will earn 10 marks and wrong answer -5. So you can have 80 marks at your stake. If a team wants to pass, if you don't know the answer, you have to speak pass loudly so that I can hear. The past question can be reattempted if you are left with the time, right? This is a non-passable round, and quiz masters and judges' decision will be final and binding to all the teams, right? So everybody might have observed this round. It is available on YouTube also, but the questions are different. So we will be starting. So as Nitin has selected flowers as denoting their sets, again I have selected since we recently have witnessed World Cup football. So again, the team has nothing to do with the questions. So there are no relations with the team with the questions. So it is just for reference only. So I will be starting with team G, right? So you have to tell me the set and then we will proceed. Okay.
Set 2, sir.
Set 2. So obviously, so they have chosen Lionel Messi, the GOAT. So I was expecting that you will choose set 2 only. Okay. So here is your question. Right? Are you ready? So here is your first question. Please be loud. An acute hot red swollen foot, often secondary to chronic diabetes mellitus, is also called as
Pass.
the cranial extension of short saphenous vein communicating with great saphenous vein directly is also known as dash vein.
Giacomin.
Giacomin is right. Oval stone appearance of mucosa is pathognomic feature of which disease?
Ulcerative colitis.
Ulcerative colitis is wrong answer. Pusa, harmonic scalpel, finger fracture techniques are used for dash organ dissection.
Pass.
Okay. The colorless translucent fluid found in biliary tract due to occluded biliary system is termed as
Pass.
Lucknow Cardiff staging is used for.
Pass.
In closing a laparotomy wound, the ideal suture length to wound length
Pass.
ratio should be what?
Pass.
Pass. After complete hemostasis, what should we look for in a patient undergoing splenectomy or ITP before closing abdomen?
Accessory spleen.
Right. So you are still having 17 seconds left. You can attempt the past question. Which one you want to attempt? 9 seconds. So the time is up. The alarm is buzzing. So they have answered 2 correctly. 20 minus 5. So 15 marks. So I will display the right answer. Hot red swollen foot is Charcot's foot. Cobblestone is seen in Crohn's disease, not in ulcerative colitis. Pusa harmonic scalpel is for liver parenchyma dissection. Colorless translucent fluid is white bile. Lucknow Cardiff staging is done for breast nodularity. And in closing the laparotomy wound, ideal 4:1. So that is answer, right? Okay. So now we will move to team F. Okay. So team F, what?
Set 4.
Set 4. So yeah, Mbappe. Okay. So France, he is going with France. Okay. So are you ready? So I want only one spokesperson to be answering. So here comes your first question. The chronic suppurative inflammation of apocrine sweat gland is called as?
Pass.
The most common extraadrenal site for occurrence of pheochromocytoma or paraganglioma is?
Organ of Zuckerland.
That is correct. Type of hiatus hernia where only GE junction lies in posterior mediastinum is also called as?
Type 1 sliding hiatus hernia.
Very good. Technique of hernia repair where a strip of external oblique aponeurosis is used for posterior wall reinforcement goes by the name of?
Shouldice.
Shouldice is wrong answer. In Barrett's esophagus, dash epithelium is replaced by dash epithelium.
Squamous epithelium is replaced by columnar epithelium.
Very good. The Maggot-Wagner grading scale is used for?
Pass.
For frozen section, how the fresh tissue is transported from OT table to pathologist?
Pass.
Okay. A transplant recipient with multiple malignant nodulo-ulcerative lesions over extremities and mucosa and HHV-8 infection is likely to be suffering from dash malignancy.
Kaposi sarcoma.
Kaposi sarcoma is right. So you still have 11 seconds. You want to attempt any fast question?
First question, peritonitis suppurativa.
That is correct. Still 3 seconds. Okay, so your time is up. So they have answered 1, 2, 3, 4, 5, 50 marks, minus 5, 1. So total 45. Well done. So I'll give you the answers. So hernia repair where you use a strip of external oblique is a D. Sarda, Mohan D. Sardas, a surgeon from Pune. Maggot-Wagner grading scale is used for diabetic foot ulcer. Frozen section, it should be transported directly, okay, without any fixative. Okay, so dry or in a saline moist gauze. Okay, so 45 marks to them. So we move on to team E. Team E.
Set
Your
8.
Set A. Okay, so you have selected Cristiano Ronaldo. Okay, Portugal. So though he had got no assistance from his team members and fortunately Portugal doesn't qualify for semi-finals, but then yes, that is life. Okay, so again, one spokesperson should answer. Okay, so here comes your first question. Frontal osteomyelitis secondary to sinusitis or meningitis presenting as overhead swelling is called as?
Pott's puffy tumor.
Pott's puffy tumor is right. Palpation of dorsalis pedis in foot is done lateral to what anatomical structure?
Medial malleolus.
Medial malleolus is wrong answer. The cell of origin for GIST, gastrointestinal stromal tumor, is considered to be?
Pass.
Pass. Okay. Child Phillips transmesenteric plication and Nobel's plication procedures are done for dash condition.
Pass.
Okay. Flap of bladder wall used to construct and replace lower third of ureter after lower ureteric injury is known as dash flap.
Board's flap.
Bohart's is wrong answer. Tokyo Consensus Guidelines 2018 is useful for grading.
Cholecystitis.
Is right answer. The ideal intraoperative pressure during laparoscopic ranges from?
Pass.
Okay, so here is your last question. Post-mastectomy, medial border of scapula becomes prominent after pushing against a wall, signify injury to which anatomical structure?
Long thoracic nerve.
Long thoracic nerve is right. So you have still 8 seconds. Do you want to attempt any past question?
Cell of origin for gist is intestinal chromatography.
Interstitial?
Intestinal chromatography.
Oh no, that is not. So negative answer. So your time is up. So they have given 3 answers right. Watts puppy tumor, acute cholecystitis, and long thoracic 30, and 3 negative answers. So minus 15. So total score is 15. The right answers: dorsalis pedis is palpated, lateral to extensor hollows is longest, and the cell of origin is interstitial cell of Cahal. Child Phillips is done for recurrent intestinal obstruction. Flap of bladder is Boari flaps, not Bohard flaps. The ideal intraoperative pressure is nearly 12 to 15 millimeters of mercury. Okay. So 15 marks to team E. Okay. So let us come to team D. Your choice of set.
Set 6.
Set 6. Okay. Germany. Yeah. Romelo. Okay. So again, identify one spokesperson, no double answering. So here is your first question. Crunching sound on auscultation owing to surgical emphysema in cases of esophageal perforation is dash sign. If you don't know, you can
Mallory
pass.
Weiss.
Huh?
Mallory Weiss.
Mallory Weiss is wrong answer. Female counterpart of encysted hydrocele of spermatic cord is called as.
Pass.
Okay. Lothesen operation is done for which surgical condition?
Femoral hernia.
Femoral hernia is right. Thumb printing sign of plain X-ray abdomen is
Ischemic colitis.
ischemic colitis is right. Ascent of isthmus in horseshoe kidney is restricted by which anatomical structure?
IMA.
IMA is very right. In Seddon's classification, where the nerve sheath is intact but fiber is damaged, is named as dash injury.
Pass.
Duodenal blowout after Billot 2 operation occurs classically on what post-operative day?
Pass.
A relative of patient of familial adenomatous polyposis attended ophthalmic OPD for screening of.
Congenital hypertrophic retinal pigmentation.
Very good. So you still have 10 seconds, so you can attempt past question 2, 6, and 7. Okay, so the time is up. So they have answered 1, 2, 3, 4 correctly and 1 negative answer. So 40 minus 5, 35 points, right? Okay, so the answer for first question is Hammond's trench or Hammond's sign. Female counterpart is hydrocele of canal of Nuck. Then you have answered this. Seddon's classification, this is acanthomesis. Then duodenal blowout after Billot 2 occurs on 4th post-op day. So these are the right answers. Okay, so they have got 35 marks. So now we move on to team C. Your choice of set.
Set 1.
Set 1. Okay, so Yamal. So the winning team of this World Cup, Spain. So again, one spokesperson, no double answers, right? So here is your first question. A manifestation of hyperdynamic circulation with pulsatile head bobbing is called as dash sign.
Demoset sign.
Demoset is right. The primary lymph nodal drainage in carcinoma testis is 2.
Para-aortic lymph nodes.
Para-aortic is right. Most common malignant parotid tumor with a high propensity for perineural split is
Adenoid cystic carcinoma.
that is right answer. In abdomen, Cocker's maneuver is done for mobilization of
Duodenum.
duodenum is right. Deficiencies of factor 5 Leydig, protein C and protein S leads to
Deep venous thrombosis.
okay, I can grant it to you. That is amplifying hypercoagulability. Jackson staging is used for dash cancers.
Penile carcinoma.
Penile is right. The primary mechanism of absorption of most of the synthetic absorbable suture is
Hydrolysis.
hydrolysis is right answer. Post gastrojejunostomy, a patient experiences sweating, tachycardia, and faintness half an hour after meals. The condition is better known as
Dumping syndrome.
dumping syndrome is right. So very good. Full on full marks. Okay, so let us move forward. Absolutely brilliant. All marks with almost 7 seconds to spare. Well done. Yeah, silence please. So now we will move on to team B. So your choice of set.
Set 5.
Set
5.
Set 5. Okay, Halan from Norway. Right. So again, no double answer, single person. Right. So here comes your first question. Non-metastatic thrombophlebitis seen in patients of CA stomach and CA pancreas is called as dash sign.
Pass.
Pass. The fascia lining anterior lower third of rectum acting as a barrier for malignant invasion is known as dash.
Pass.
The ideal surgical treatment for neuroendocrine tumor of size more than 2 centimeters arising from appendix is
Appendectomy.
no. Classical bottle neck or flask-shaped ulcer in colon occurs in which disease?
Typhoid.
Typhoid is again wrong answer. Mid-face fracture line that causes craniofacial disjunction is classified as dash fracture. Type dash fracture.
Lifford class 2.
Class 2 is wrong answer. Southampton and asepsis grading is used to classify.
Surgical site infection.
That is right. Number 22, 23 and 24 surgical blade fits into what number of BP? Bart Parker handle.
Pass.
Pass. A 35-year-old female patient presented with recurrent heart locally invasive infraumbilical tumor in anterior abdominal wall with no metastasis. Likely diagnosis is.
So first answer, Trousseau syndrome.
Okay, first answer you want to answer Trousseau syndrome. Okay, Trousseau sign. I can give it to them. Okay, so they have answered only 2 questions, so 20 marks and 3 negative. So minus 15, so total 5 marks. Right. So the answers for rest of the questions: fascia lining anterior is Denon-Wheeler's fascia. Ideal treatment for tumor more than 2 centimeters is hemicolectomy, right? Hemicolectomy. Bottleneck or flask shape is seen in amoebic colitis, not in typhoid. Mid-face craniofacial distension is Leaford type 3. Okay, Bart Parker number 4 BP handle, and this is desmoid tumor, a locally invasive tumor, right? So they get only 5 points. Okay. So now coming on to the last set, last question to team A of this quiz 2026. Set
9.
Set 9. Okay, so you want to go with US. Callaghan, he was the top scorer for US team. Okay, so again, are you ready? One spokesperson and no double answer. Right. So here comes your first question. A venous hump heard just below Ziphite process on auscultation in a case of portal hypertension is dash sign.
Pass.
Pass. In second brachial cleft fistula, the internal opening is located at dash.
Pass.
Longitudinally placed ulcer in terminal ileum with microscopic erythrophagocytosis is classically seen in dash.
Pass.
In Oringer's transhiatal esophageectomy, the anastomosis is done in which region?
Neck.
Right. Most common cause for secondary hyperparathyroidism is
Chronic renal failure.
right. Possum scoring system is useful for prediction of
Pass.
endoscopic sphincterotomy at ampulla is done at dash o'clock position.
Pass.
A laborer working on vibratory tools develops recurrent episodes of whitish to bluish discoloration of fingers with pain followed by flushing. Likely diagnosis is
Raynaud's phenomenon.
Raynaud's phenomenon. So if you have got 13 seconds, you want to attempt fast question 1, 2, 3, 6 and 7. Okay, so they have answered 3 questions correctly without any negative marking, so they will get 30 marks. Right, so a venous hump is Canavi's sign. Second brachial cleft fistula, it opens in the tonsillar fossa. Longitudinal face ulcer, now here is the answer typhoid ulcer or typhoid arthritis. Possum scoring is for post-op morbidity and mortality, and endoscopic sphincterotomy should be done at 11 to 1, anywhere between 11 to 1, because there are no quiz over there, right? So thank you everyone for this quiz, and thank you ASN for giving me the opportunity of conducting this quiz. Thank you Dubashish sir for conducting it here. Thank you everyone. So till the time we are ready with the scores, I request all the team members to please have your seat in the audience. I request Praveen Veragade sir and Deepa madam to. I hand over the mic to Dr. Praveen Veragade sir, Honorary Secretary of ASN. The result will be announced by chairman. Prachi ma'am, the result will be announced by chair.
So the quiz time is over. We are waiting for the results. Meanwhile, we are likely to felicitate our judges, our quiz masters, and the backbone of our quiz logistics. That is the scorer and the timekeeper. So I invite Dr. Praveen Vairagade sir to do the proceedings.
Thank you, ma'am. As we conclude the quiz, we'd like to thank, though I've done Thanksgiving before, some important people have left behind. The ASN cannot forget the contribution made by few people for this quiz. The first is Dr. Prachi Mahajan madam, who has donated 20,000 rupees for this quiz. Thank you very much, madam. Then Dr. Prabhat Linchkode sir, he has also donated the prize money for this quiz. Thank you, sir, wherever you are. He could not attend the program, but he has given the prize money. Thank you very much, sir. Then Dr. Padoye sir, a leading surgeon, has also promised some donation to the for this quiz. Now I'd like to felicitate Dr. Nirmal sir, who is the co-chairman of this quiz committee, with the hands of our president. Thank you, Dr. Nirmal sir. He has make a great effort. He has arranged all clinic meetings at Aureus Hospital. Subhashi sir, please come on the stage to felicitate us. Now I like to call Dr. B.S. Gedam sir, our judge for this program, who has done a great job in helping us and conducting a smooth ceremony. Dr. B.B. Gupta sir, please, he's our guru, our guide. Or sir, Gedam sir, please stay on the stage. All the judges will stay on the stage. Dr. Rajendra Saoji, sir. He is not only judge, but he has also done a great effort during the preparation of quiz. Now I like to honor the quiz masters of this program. First, I like to call Dr. Abdul Qureshi, sir. Dr. Prachi Mahajan, Dr. Mrinalini Borkar, madam. I think Dr. Mrinalini Borkar, madam. I think she has left. Dr. Devi Saxena. Devi Saxena, sir, please come on stage. Dr. Nirmal Patle, sir. Dr. Vandana Tome, madam. Dr. Nitin Sherekar, sir. Yeah, very popular figure. Dr. Nitin. Dr. Rajvilas Narkhade. And none other than Soumya Ghoshal. Another smart boy. Smart, sir. Thank you. Now I like to call time scorekeepers and timekeeper who had done a great job sitting continuously. I was watching, you are continuously sitting hours together. Dr. Raju Sonarkar, sir. Dr. Tanmay Tapase, sir. Dr. Savarkar. Dr. Dheeraj Sagrude, sir. Thank you all.
So are the scores ready?
Okay, guys, are you ready to know the result? Come on, your wives. Have a big applause. Okay, so we will start the result now. Fantastic event. All of you have, everybody has a winner here and everybody participates. So I congratulate you, all of you. Now, guess it, who is the second runner-up? I want guess from you. Second runner-up, anyone guess? GMC Sambhaji Nagar. Now out of these 7, now remain 6.
All the
So
past
GMC
presidents and quiz master, please come on the stage.
Sambhaji Nagar
Join.
have a marks 190, 190. Now the guess first runner-up. जोर से NKP Sims Nagpur having marks 205. So NKP Sims Nagpur first runner-up. Okay, now I want some big noise here. So GMC Sambhaji Nagar 190. Second runner-up. Okay, NKP Sims Nagpur. A big round of applause for second runner-up. GMC Sambhaji Nagar. Many congratulations, guys. So first runner-up, NKP Sims Nagpur. Please come on. Have a big round of applause. Congratulations, NKP Nagpur for first runner-up. But now the time comes for to say today's winner. Have a noise something. Today's winner, All India Institute of Medical Sciences, Nagpur. Your winner, guys, AIMS Nagpur. So 28th Dr. Indrajit Mitra Memorial State Level Surgical Quiz. And winner is AIMS Nagpur. Nice. So at 4th, JNMC Savangi. Congratulations, all participants. So at 4th place, JNMC Savangi, 160 marks. At 5th place, GMC Vidisha, 105. Sevagram, 90. And 7th, UPMC Jalgaon, 80. So give a big round of applause all the participants. Thank you.
Students need not leave. We will provide you lunch. Please don't go.
I request all the quiz masters to be on the stage for a group photograph. All the quiz masters. Rajvilas. All the quiz masters. Rajvilas. Dr. Rajvilas.
Everybody is requested to